Hey, Alpha Nurses. I'm Licensure from AlphaNurseGuy.com. This is 250 practice NCLEX questions. Without delay, let's get started.
The nurse is teaching an older patient about risks for fractures and osteoporosis. Which diagnostic test should the nurse teach about when the goal is to establish the patient's bone strength and determine if osteoporosis is present? 1. Computed tomography scan. 2. Magnetic resonance imaging scan. 3. Dual energy X-ray absorptiometry scan. 4. Joint X-rays. The correct answer, 3. Dual energy X-ray absorptiometry scan. Rationale. Testing bone density is the only way to know for sure whether or not a patient has osteoporosis. A diagnostic test commonly prescribed by healthcare providers is dual energy X-ray absorptiometry scan. This type of scan focuses on two main areas, the hip and the spine. The forearm can be tested, however, if the hip or spine cannot be tested. The other tests may be prescribed, but are not as commonly used to test bone strength.
Which of the following is an expected outcome for a client who is recovering from an abdominal perineal resection with a colostomy? The client will 1. Maintain a fluid intake of 3,000 milliliters per day. 2. Eliminate fiber from the diet. 3. Limit physical activity to light exercise. 4. Accept that sexual activity will be diminished. The correct answer is 1. Maintain a fluid intake of 3,000 milliliters per day. An expected outcome is that the client will maintain a fluid intake of 3,000 milliliters per day, unless contraindicated. There is no need to eliminate fiber from the diet. The client can eat whatever foods are desired, avoiding those that are bothersome. Physical activity does not need to be limited to light exercise. The client can resume normal activities as tolerated, usually within 6 to 8 weeks. The client's sexual activity may be affected, but it does not need to be diminished. A 67-year-old patient who is receiving chemotherapy for lung cancer is admitted to the hospital with thrombocytopenia. Which statement made by the patient when the nurse is obtaining the admission history is of most concern? 1. I've noticed that I bruise more easily since the chemotherapy started. 2. My bowel movements are soft and dark brown. 3. I take ibuprofen every day because of my history of osteoarthritis. 4. My appetite has decreased since the chemotherapy started. The correct answer is 3. I take ibuprofen every day because of my history of osteoarthritis. Because nonsteroidal anti-inflammatory drugs will decrease platelet aggregation, patients with thrombocytopenia should not use ibuprofen routinely. Patient teaching about this should be included in the care plan. Bruising is consistent with the patient's admission problem of thrombocytopenia. Soft, dark brown stools indicate that there is no frank or occult blood in the bowel movements. Although the patient's decreased appetite requires further assessment by the nurse, this is a common complication of chemotherapy. The client diagnosed with influenza A is being discharged from the emergency department with a prescription for antibiotics. Which statement by the client indicates an understanding of this prescription? 1. These pills will make me feel better fast, and I can return to work. 2. The antibiotics will help prevent me from developing a bacterial pneumonia. 3. If I had gotten this prescription sooner, I could have prevented this illness. 4. I need to take these pills until I feel better, then I can stop taking the rest. The correct answer is 2. The antibiotics will help prevent me from developing a bacterial pneumonia. Secondary bacterial infections often accompany influenza, and antibiotics are often prescribed to help prevent the development of a bacterial infection. Antibiotics will not prevent the flu. Only the flu vaccine will prevent the flu. When people take portions of the antibiotic prescription and stop taking the remainder, an antibiotic-resistant strain of bacteria may develop, and the client may experience a return of symptoms. But this time, the antibiotics will not be effective. A person with a viral infection should not return to work until the virus has run its course, because the antibiotics help prevent complications of the virus, but they do not make the client feel better faster. The nurse is completing AM care with a client diagnosed with angina when the client reports chest pain. The client has a saline lock in the right forearm. Which intervention should the nurse at the bedside implement first? 1. Assess the client's vital signs. 2. Administer sublingual nitroglycerin. 3. Administer IV morphine sulfate via saline lock. 4. Administer oxygen via nasal cannula. The correct answer is 4. Administer oxygen via nasal cannula. The nurse would have oxygen at the bedside, and applying it would be the first intervention the nurse could implement at the bedside. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client with vasospastic disorder, Raynaud's phenomenon, is considering having a sympathectomy. This nurse should tell the client that the surgery is performed 1. In the early stages of the disease to prevent further circulatory disturbances. 2. When the disease is controlled by medication. 3. When the client is unable to control stress-related vasospasm. 4. When all other treatment alternatives have failed. The correct answer is 4. Sympathectomy is scheduled only after other treatment alternatives have been explored and have failed. Medication and stress management are beneficial strategies to prevent advancement of the disease process. If the disease is controlled by medication, there is no reason for surgery.
Which of the following interventions is most appropriate for a client who has stomatitis? 1. Drinking hot tea at frequent intervals. 2. Gargling with antiseptic mouthwash. 3. Using an electric toothbrush. 4. Eating a soft, bland diet. The correct answer is 4. Eating a soft, bland diet. Clients with stomatitis, inflammation of the mouth, have significant discomfort, which impacts their ability to eat and drink. They will be most comfortable eating soft, bland foods and avoiding temperature extremes in their food and liquids. Gargling with an antiseptic mouthwash will be irritating to the mucosa. Mouth care should include gentle brushing with a soft toothbrush and flossing.
Which of the following statements made by an adolescent who has just begun taking an antidepressant would indicate the need for further teaching about the action of antidepressants in treating depression? 1. Now that I've been taking my antidepressant for a week, I'm going to feel better about myself. 2. A week ago when I started my antidepressant, I didn't care about eating, but now I want to eat a bit more. 3. After a week of taking my antidepressant, I can sleep a little better, 6 hours or so each night. 4. Now that I've had a week of my antidepressant, it is a little easier to get up in the morning. The correct answer is 1. Now that I have been taking my antidepressant for a week, I'm going to feel better about myself. Rationale. In the first week or so of taking an antidepressant, the vegetative symptoms of depression such as poor sleep, appetite, and energy level improve. However, it takes 3 to 4 weeks for improvement in self-concept/self-esteem to take place.
A faculty member of a nursing program is conducting an informational session for potential nursing students. Which information about licensure to practice nursing upon completion of a nursing program should the faculty member include in the session? 1. It is a responsibility of the American Nurses Association. 2. It is granted on graduation from a nursing program. 3. It is approved by the National League for Nursing. 4. It is required by law in each individual state. The correct answer is 4. It is required by law in each individual state. The American Nurses Association standards of clinical nursing practice do not address licensure. When a person graduates from a school of nursing, the individual receives a diploma that indicates completion of a course of study. The diploma is not a license to practice nursing. The National League for Nursing promotes nursing service and nursing education. It is not involved with licensure. The Nurse Practice Act in a state stipulates the requirements for licensure within the state.
The nurse observes the assistive personnel performing all of these interventions for a patient with carpal tunnel syndrome, which action requires that the nurse intervene immediately. 1. Arranging the patient's lunch tray and cutting his meat. 2. Providing warm water and assisting the patient with his bath. 3. Replacing the patient's splint in hyperextension position. 4. Reminding the patient not to lift very heavy objects. The correct answer is 3, replacing the patient's splint in hyperextension position. Rationale. When a patient with CTS has a splint to immobilize the wrist is placed either in the neutral position or in slight extension, not hyperextension. The other interventions are correct and are within the scope of practice of an AP. APs may remind patients about elements of their care plans that have already been taught, such as avoiding heavy lifting.
Which is the correct order, from first to last, for proper placement of a urinary catheter? 1. Lubricate the catheter adequately with a water-soluble lubricant. 2. Ensure free flow of urine. 3. Insert the catheter far enough into the bladder to prevent trauma to the urethral tissue. 4. Prepare a sterile field. The correct order is 4. Prepare a sterile field. 1. Lubricate the catheter adequately with a water-soluble lubricant. 3. Insert the catheter far enough into the bladder to prevent trauma to the urethral tissue. And 2. Ensure free flow of urine. After gathering appropriate supplies, the nurse should prepare a sterile field. After lubricating the catheter adequately with a water-soluble lubricant to minimize trauma to the urethra, the nurse should insert the catheter far enough into the bladder so the retention balloon does not traumatize urethral tissues. Ensuring a free flow of urine prevents infection. Improper drainage occurs when tubing is kinked or twisted. The client will have an abdominal hysterectomy tomorrow. Which of the following information will be most important for the nurse to give to the client prior to admission to the hospital? 1. What to wear to the hospital. 2. What she can eat and drink before admission. 3. The type of pain medication that will be prescribed post-operatively. 4. The amount of activity she can have after surgery. The correct answer is 2. What she can eat and drink before admission. It is a priority that the client knows she will not be able to eat or drink for 8 hours before admission. A client who consumes food and fluid before receiving a general anesthetic is at risk for aspiration, which can lead to aspiration pneumonia, respiratory arrest, and even death. The clothing she should wear to the hospital and the type of medication she will receive are important, but not the priority. Information on exercise and resumption of normal activities can be included in the discharge teaching. The client with the flu is prescribed the OTC cough suppressant dextromethorphan. Which information should the nurse teach regarding this medication? 1. Take the medication every 4 to 8 hours as needed for cough. 2. The medication can cause addiction if taken too long. 3. Do not drive or operate machinery while taking the drug. 4. Do not take a beta blocker while taking this medication. The correct answer is 1. Take the medication every 4 to 8 hours as needed for cough. Dextromethorphan is relatively safe in the recommended dose range of 10 to 30 milligrams every 4 to 8 hours. At these levels, it does not produce respiratory depression and side effects are not common. Dextromethorphan is an antitussive. This medication does not have the potential to cause addiction. This medication does not produce drowsiness, so driving or operating machinery while taking dextromethorphan is acceptable. The medication does not slow the heart rate, and there is no reason for a client not to take a prescribed beta blocker medication while taking dextromethorphan.
A client who had received 25 milliliters of packed red blood cells has low back pain and pruritus after stopping the infusion. The nurse should take what action next? 1. Administer prescribed antihistamine and aspirin. 2. Collect blood and urine samples and send to the lab. 3. Administer prescribed diuretics. 4. Administer prescribed vasopressors. The correct answer is 2. ABO and Rh incompatible blood causes an antigen-antibody reaction that produces hemolysis or agglutination of red blood cells. At the first indication of any sign/symptom of reaction, the blood transfusion is stopped. Blood and urine samples are obtained from a client and sent to the lab along with the remaining untransfused blood. Hemoglobin in the urine and blood samples taken at the time of the reaction provide evidence of a hemolytic blood transfusion reaction. Antihistamine, aspirin, diuretics, and vasopressors may be administered with different types of transfusion reactions.
The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. The correct order is 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. And 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with the fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client who is NPO for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Alteplase recombinant, or tissue plasminogen activator, TPA, a thrombolytic enzyme, is administered during the first 6 hours after onset of myocardial infarction to 1. Control chest pain. 2. Reduce coronary artery vasospasm. 3. Control the arrhythmias associated with MI. 4. Revascularize the blocked coronary artery. The correct answer is 4. Revascularize the blocked coronary artery. Rationale: the thrombolytic agent TPA, administered intravenously, lyses the clot blocking the coronary artery. The drug is most effective when administered within the first 6 hours after onset of MI. The drug does not reduce coronary artery vasospasm. Nitrates are used to promote vasodilation. Arrhythmias are managed by antiarrhythmic drugs. Surgical approaches are used to open the coronary artery and reestablish a blood supply to the area.
The nurse is preparing to administer medication in a labor and delivery unit. Which medication should the nurse question administering? 1. Magnesium sulfate to a client diagnosed with preeclampsia. 2. Dinoprostone to a client diagnosed with asthma. 3. Betamethasone to a client who is 27 weeks pregnant. 4. Oxytocin to a client diagnosed with an incomplete abortion. The correct answer is 2. Dinoprostone to a client diagnosed with asthma. The synthetic prostaglandin dinoprostone is used cautiously in clients who have asthma because it can initiate an asthmatic attack. Therefore, the nurse should question administering this medication. The client with preeclampsia would be receiving the anticonvulsant magnesium sulfate to help prevent seizures. Therefore, the nurse would not question administering this medication. The corticosteroid betamethasone is a medication used to increase surfactant in fetal lungs and would be administered to a client who is less than 34 weeks pregnant. Therefore, the nurse would not question administering this medication. Oxytocin, a uterine stimulant, would be administered after a client has experienced an incomplete abortion to help the client expel the fetal fragments. Therefore, the nurse would not question administering this medication.
The nurse is supervising a newly graduated nurse caring for a patient with a fracture of the right ankle who is at risk for complications of immobility. For which action should the supervising nurse intervene? 1. Encouraging the patient to go from a lying to a standing position. 2. Administering pain medication before the patient begins exercises. 3. Explaining to the patient and family the purpose of the exercise program. 4. Reminding the patient about the correct use of crutches. The correct answer is 1. Encouraging the patient to go from a lying to a standing position. Rationale: moving directly from a lying to a standing position does not allow the patient to establish balance. The supervising nurse should instruct the newly graduated nurse about moving the patient from a lying position first, then to a sitting position, and finally to a standing position, which will allow the patient to establish balance before standing. Administering pain medication before the patient begins exercising decreases pain with exercise. Explanations about the purpose of the exercise program and proper use of crutches are appropriate interventions for this patient.
Which of the following is a potential risk factor for the development of colon cancer? 1. Chronic constipation. 2. Long-term use of laxatives. 3. History of smoking. 4. History of inflammatory bowel disease. The correct answer is 4. History of inflammatory bowel disease. A history of inflammatory bowel disease is a risk factor for colon cancer. Other risk factors include age, history of familial polyposis, colorectal polyps, and high-fat or low-fiber diet. A patient with sickle cell disease is admitted with splenic sequestration. The blood pressure is 86/40, and heart rate is 124 beats per minute. Which of these actions will the nurse take first? 1. Complete a head-to-toe assessment. 2. Draw blood for type and cross-match. 3. Infuse normal saline at 250 ml per hour. 4. Ask the patient about vaccination history. The correct answer is 3. Infuse normal saline at 250 ml per hour. Because the patient is severely hypotensive, correction of hypovolemia caused by the splenic sequestration is the most urgent action. Nevertheless, the other actions are appropriate because a complete assessment will be needed to plan care, a transfusion is likely to be needed, and vaccination history is pertinent for patients with sickle cell disease. Infusion of saline, however, is the priority need. The nurse is caring for a client diagnosed with a stage 3 pressure ulcer. The client has a Combiderm non-adhesive, sterile, hydrocolloidal dressing. Which data indicates the dressing is ready to be removed? 1. The exudate begins to pool on the wound surface. 2. The color of the drainage changes from brown to a yellow-gray. 3. The HCP must write an order to remove the dressing. 4. The softened area is approaching the edge of the dressing. The correct answer is 4. The softened area is approaching the edge of the dressing. This dressing is an absorbent hydrocolloidal dressing that provides a moist environment, absorbs exudates, and is non-damaging to the skin. When the softened area approaches the edge of the dressing, it must be removed, and a new one must be applied. Option 1 would indicate when an alginate dressing, not a hydrocolloidal dressing, is ready to be removed. The iodosorb gel, not the Combiderm dressing, should be changed when the color changes from brown to a yellow-gray. The nurse does not need a written order from the HCP to change the dressing. A child is complaining of throat pain. Which statement by the mother indicates that she needs more education regarding the care and treatment of her child's pharyngitis? 1. I will have my child gargle with salt water 3 times a day. 2. I will offer my child ice chips several times a day. 3. I will give my child Tylenol every 4 to 6 hours as needed. 4. I will ask the nurse practitioner for some amoxicillin. The correct answer is 4. I will ask the nurse practitioner for some amoxicillin. Pharyngitis is a self-limiting viral illness that does not require antibiotic therapy. Pharyngitis should be treated with rest and comfort measures, including Tylenol, throat sprays, cold liquids, and popsicles.
When instructing a client who has been newly diagnosed with vasospastic disorder, Raynaud's phenomenon, about management of care, the nurse should discuss which of the following topics? 1. Scheduling a sympathectomy procedure for the next visit. 2. Using a beta blocker medication. 3. Follow-up monitoring for development of connective tissue disease. 4. Benefit of an angioplasty to the affected extremities. The correct answer is 3. Clients with Raynaud's phenomenon should receive routine follow-up to monitor symptoms and to assess the development of connective tissue or autoimmune diseases associated with Raynaud's. Beta blockers are not considered first-line drug therapy. A sympathectomy is considered only in advanced cases. There is no benefit to an angioplasty, which is used for atherosclerotic vascular disease.
The nurse is witnessing the client's signature on the informed surgical consent for an abdominal hysterectomy. It is important to ascertain that the client understands that with this surgical procedure, she will have 1. Decreased libido, 2. Infertility, 3. Depression, 4. Weight gain. The correct answer is 2. Infertility. The client needs to understand that with removal of the uterus, she will no longer be able to bear children or have menstrual periods. The surgical procedure should not change her libido or sexual functioning. Research does not support the idea that hysterectomy contributes to depression or weight gain. Research demonstrates that women who have managed health problems for some time before the hysterectomy may actually have a more positive effect, with less worry about their health condition, contraception, or pregnancy. A female with uterine fibroids has dysmenorrhea and menorrhagia. After reviewing the laboratory reports, the nurse should report which results to the healthcare provider. Select all that apply. 1. Hemoglobin 9.0 grams per deciliter. 2. Hematocrit 27.1%. 3. White blood cell count 10,000 cells per cubic milliliter. 4. Potassium 4.0 milliequivalents per liter. 5. Normocytic red blood cells. The correct answers are 1. Hemoglobin 9.0 grams per deciliter and 2. Hematocrit 27.1%. A woman with uterine fibroids and dysmenorrhea is at risk for iron deficiency anemia. The hemoglobin and hematocrit indicate the likelihood that the fibroids causing heavy menstrual blood loss have resulted in anemia. A hemoglobin of less than 12 grams per deciliter in women is considered low. The white blood cell count and potassium levels are within normal parameters, and normocytic red blood cells are normal.
A client is to receive EPOIN injections. What laboratory value should the nurse assess before giving an injection? 1. Hematocrit. 2. Partial thromboplastin time. 3. Hemoglobin concentration. 4. Prothrombin time. The correct answer is 1. EPOIN is a recombinant DNA form of erythropoietin, which stimulates the production of red blood cells and therefore causes the hematocrit to rise. The elevation in hematocrit causes an elevation in the blood pressure. Therefore, the blood pressure is a vital sign that should be checked. The partial thromboplastin time, hemoglobin level, and prothrombin time are not monitored for this drug.
The nurse is caring for a client who has just had an upper GI endoscopy. The client's vital signs must be taken every 30 minutes for 2 hours after the procedure. The nurse assigns an unlicensed nursing personnel to take the vital signs. 1 hour later, the UAP reports the client, who was previously hay-febrile, has developed a temperature of 101.8 degrees Fahrenheit. What should the nurse do in response to these reported assessment data? 1. Promptly assess the client for potential perforation. 2. Tell the assistant to change the thermometers and retake the temperature. 3. Plan to give the client acetaminophen to lower the temperature. 4. Ask the UAP to bathe the client with tepid water. The correct answer is 1. Promptly assess the client for potential perforation. A sudden spike in temperature following an endoscopic procedure may indicate perforation of the GI tract. The nurse should promptly conduct a further assessment of the client, looking for further indicators of perforation, such as a sudden onset of acute upper abdominal pain, a rigid, board-like abdomen, and developing signs of shock. Telling the assistant to change the thermometers is not an appropriate action and only further delays the appropriate action of assessing the client. The nurse would not administer acetaminophen without further assessment of the client or without a physician's prescription. A suspected perforation would require that the client be placed on nothing-by-mouth status. Asking the assistant to bathe the client before any assessment by the nurse is inappropriate.
After the administration of TPA, the nurse should 1. Observe the client for chest pain. 2. Monitor for fever. 3. Review the 12-lead electrocardiogram (ECG). 4. Auscultate breath sounds. The correct answer is 1. Observe the client for chest pain. Rationale. Although monitoring the 12-lead ECG and monitoring breath sounds are important, observing the client for chest pain is the nursing assessment priority because closure of the previously obstructed coronary artery may recur. Clients who receive TPA frequently receive heparin to prevent closure of the artery after administration of TPA. Careful assessment for signs of bleeding and monitoring of partial thromboplastin time are essential to detect complications. Administration of TPA should not cause fever.
The nurse is preparing an amnio infusion for a client who is experiencing severe variable decelerations of the fetal heart rate. Which solution should the nurse expect to administer through the intrauterine pressure catheter? Select all that apply. 1. Normal saline. 2. 5% dextrose in water. 3. Lactated Ringer's solution. 4. Albumin 25% solution. 5. Dextrose and saline. The correct answers are 1. Normal saline and 3. Lactated Ringer's solution. Normal saline is used in amnio infusion. It can cause slight changes in fetal electrolytes, but is an acceptable fluid. Lactated Ringer's solution is the preferred fluid for amnio infusion. 5% dextrose in water is not indicated for amnio infusion. Albumin is a blood product prepared from plasma and is not used for this procedure. Dextrose and saline is not indicated for amnio infusion.
The charge nurse is assigning the nursing care of a patient who had a left below the knee amputation 1 day ago to an experienced nurse who will function under the lead nurse's supervision. What will the lead nurse tell the experienced nurse is a major focus for the patient's care today? 1. To attain pain control over phantom pain. 2. To monitor for signs of sufficient tissue perfusion. 3. To assist a patient to ambulate as soon as possible. 4. To elevate the residual limb when the patient is supine. The correct answer is 2. To monitor for signs of sufficient tissue perfusion. Rationale. Monitoring for sufficient tissue perfusion is a priority at this time. Phantom pain is a concern, but is more common in patients with above-the-knee amputations. Early ambulation is a goal, but at this time, the patient is more likely to be engaged in muscle-strengthening exercises. Elevating the residual limb on a pillow is controversial because it may promote knee flexion contracture.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is conducting a community presentation on the early detection of colon cancer. Which of the following should the nurse encourage members of the audience to report to their healthcare providers? Select all that apply. 1. Fatigue. 2. Unexplained weight loss with adequate nutritional intake. 3. Rectal bleeding. 4. Bowel changes. 5. Positive fecal occult blood testing. The correct answers are 1. Fatigue. 2. Unexplained weight loss with adequate nutritional intake. 3. Rectal bleeding. 4. Bowel changes. And 5. Positive fecal occult blood testing. Colorectal cancer may be asymptomatic, or symptoms vary according to the location of the tumor and the extent of involvement. Fatigue, weight loss, and iron deficiency anemia, even without rectal bleeding or bowel changes, should prompt investigation for colorectal cancer. Fecal occult blood testing commonly reveals evidence of carcinoma when the client is otherwise asymptomatic. When administering a blood transfusion to a patient, which action can the nurse delegate to the assistive personnel? 1. Take the patient's vital signs before the transfusion is started. 2. Ensure that the blood is infused within no more than 4 hours. 3. Ask the patient at frequent intervals about the presence of chills or dyspnea. 4. Assist with double-checking the patient's identification and blood bag number. The correct answer is 1. Take the patient's vital signs before the transfusion is started. AP education and role includes obtaining vital signs, which will be reported to the nurse before the initiation of the transfusion. Monitoring for transfusion reactions, adjusting the transfusion rate, and ensuring that the blood type and number are correct require critical thinking and should be done by the nurse. The client diagnosed with a stage 2 pressure ulcer is prescribed a hydrogel dressing. Which statement indicates the client understands the teaching about the hydrogel dressing? 1. The hydrogel dressing is soothing and reduces pain. 2. It must be used because my pressure ulcer drains a lot. 3. This dressing can only be used if my wound is not infected. 4. This dressing is very difficult to apply and remove from the wound. The correct answer is 1. The hydrogel dressing is soothing and reduces pain. Hydrogels help maintain a moist healing environment, granulation, and epithelialization, and they facilitate autolytic debridement. One advantage of a hydrogel dressing is that it is soothing and reduces pain. One of the disadvantages of hydrogel dressings is that they are not recommended for wounds with heavy exudate. An advantage of using hydrogel dressings is that they can be used when infection is present. An advantage of using hydrogel dressings is that they are easily applied and removed from the wound. A school-age child has been diagnosed with strep throat. The parent asks the nurse when the child can return to school. Which is the nurse's best response? 1. 48 hours after the first documented normal temperature. 2. 24 hours after the first dose of antibiotics. 3. 48 hours after the first dose of antibiotics. 4. 24 hours after the first documented normal temperature. The correct answer is 2. 24 hours after the first dose of antibiotics. Children with strep throat are no longer contagious 24 hours after initiation of antibiotic therapy.
A client has been diagnosed with vasospastic disorder, Raynaud's phenomenon, on the tip of the nose and fingertips. The physician has prescribed reserpine to determine if the client will obtain relief. The client often works outside in cold weather and also smokes 2 packs of cigarettes per day. Which of the following should be included in the discharge plan for this client? Select all that apply. 1. Stopping smoking. 2. Wearing a face covering and gloves in the winter. 3. Placing fingertips in cool water to rewarm them. 4. Finding employment that can be done in a warm environment. 5. Reporting signs of orthostatic hypotension. The correct answers are 1, 2, and 5. Vasospastic disorder, Raynaud's disease, is a form of intermittent arteriolar vasoconstriction that results in coldness, pain, and pallor of the fingertips, toes, or tip of the nose, and a rebound circulation with redness and pain. The nurse should instruct the client to stop smoking because nicotine is a vasoconstrictor. An adverse effect of reserpine is orthostatic hypotension. The client should report dizziness and low blood pressure, as it may be necessary to consider stopping the drug. The client should prevent vasoconstriction by covering affected parts when in cold environments. The nurse can teach the client to rewarm exposed extremities by using warm water or placing them next to the body, such as under the axilla. It is not realistic to ask this client to change jobs at this time.
Which of the following lipid abnormalities is a risk factor for the development of atherosclerosis and peripheral vascular disease? 1. Low concentration of triglycerides. 2. High levels of high-density lipid cholesterol. 3. High levels of low-density lipid cholesterol. 4. Low levels of LDL cholesterol. The correct answer is 3. High levels of low-density lipid cholesterol. An increased LDL cholesterol concentration has been documented as a risk factor for the development of atherosclerosis. LDL cholesterol is not broken down in the liver, but is deposited into the intima of the blood vessels. Low triglyceride levels are desirable. High HDL and low LDL levels are beneficial and are known to be protective for the cardiovascular system. The nurse is assessing the lower extremities of the client with peripheral vascular disease. During the assessment, the nurse should expect to find which of the following clinical manifestations of PVD? Select all that apply. 1. Hairy legs. 2. Mottled skin. 3. Pink skin. 4. Coolness. 5. Moist skin. The correct answers are 2. Mottled skin and 4. Coolness. Reduction of blood flow to a specific area results in decreased oxygen and nutrients. As a result, The skin may appear mottled. The skin will also be cool to the touch. Loss of hair and dry skin are other signs that the nurse may observe in a client with PVD of the lower extremities.
The nurse is receiving a patient with peripheral vascular disease from the post-anesthesia care unit after a SIME amputation of the right lower extremity. At which level on this diagram would the nurse expect to find the amputation? 1A, 2B, 3C, 4D. The correct answer is 3C. Rationale. When a patient has a SIME amputation, most of the foot is removed but the ankle remains. Advantages of the surgery over below the knee include that the patient can still be weight-bearing and that there is less pain.
A client with colon cancer has developed osseties. The nurse should conduct a focused assessment for which of the following? Select all that apply. 1. Respiratory distress. 2. Bleeding. 3. Fluid and electrolyte imbalance. 4. Weight gain. 5. Infection. The correct answers are 1. Respiratory distress and 3. Fluid and electrolyte imbalance. Osseties limits the movement of the diaphragm, leading to respiratory distress. Fluid shift from the intravascular space precipitates fluid and electrolyte imbalances. Weight gain is not a direct consequence of osseties, but weight loss may result in decreased albumin levels. Decreased albumin in the intravascular space results in decreased oncotic pressure, precipitating movement of fluid out of space. A client with osseties is not at increased risk for infection unless a peritoneal tap is done to remove fluid. The risk of bleeding is a result of alterations in liver enzymes affecting coagulation. After a car accident, a patient with a medical alert bracelet indicating hemophilia A is admitted to the emergency department. Which action prescribed by the healthcare provider will the nurse implement first? 1. Transport the patient to the radiology department for cervical spine radiography. 2. Transfuse factor VII concentrate. 3. Type and cross-match for 4 units of packed red blood cells. 4. Infuse normal saline at 250 ml per hour. The correct answer is 2. Transfuse factor VII concentrate. When a hemophiliac patient is at high risk for bleeding, the priority intervention is to maximize the availability of clotting factors. The other prescribed actions should also be implemented rapidly, but do not have as high a priority as administering clotting factors. The nurse is developing a plan of care for a client diagnosed with laryngitis and identifies the client problem, altered communication. Which intervention should the nurse implement? 1. Instruct the client to drink a mixture of brandy and honey several times a day. 2. Encourage the client to whisper instead of trying to speak at a normal level. 3. Provide the client with a blank notepad for writing any communication. 4. Explain that the client's aphonia may become a permanent condition. The correct answer is 3. Provide the client with a blank notepad for writing any communication. Voice rest is encouraged for the client experiencing laryngitis. Aphonia, or inability to speak, is a temporary condition associated with laryngitis. The client with laryngitis is instructed to avoid all alcohol. Alcohol causes increased irritation of the throat. Whispering places added strain on the larynx. Encouraging the use of alcohol, with the exception of a glass of red wine, is not accepted medical practice. Therefore, option 1 could be eliminated. Option 4 has an absolute, permanent, in it and therefore could be eliminated from consideration. The client being discharged after sustaining an acute MI is prescribed lisinopril. Which instruction should the nurse include when teaching about this medication? 1. Instruct the client to monitor the blood pressure weekly. 2. Encourage the client to take medication on an empty stomach. 3. Discuss the need to rise slowly from lying to a standing position. 4. Teach the client to take the medication at night only. The correct answer is 3. Discuss the need to rise slowly from lying to a standing position. This medication causes orthostatic hypotension, and the client should be instructed to rise slowly from lying to sitting to standing position to prevent falls and injury.
A client with pernicious anemia asks why it is necessary to take vitamin B12 injections forever. Which is the nurse's best response? 1. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient acid. 2. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. 3. The reason for your vitamin deficiency is an excessive excretion of the vitamin because of kidney dysfunction. 4. The reason for your vitamin deficiency is an increased requirement for the vitamin because of rapid red blood cell production. The correct answer is 2. Most clients with pernicious anemia have deficient production of intrinsic factor in the stomach. Intrinsic factor attaches to the vitamin in the stomach and forms a complex that allows the vitamin to be absorbed in the small intestine. The stomach is producing enough acid. There is not an excessive excretion of the vitamin, and there is not a rapid production of red blood cells in this condition.
A client who has a history of mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition.
Which of the following is an expected outcome when a client is receiving an IV administration of furosemide? 1. Increased blood pressure. 2. Increased urine output. 3. Decreased pain. 4. Decreased premature ventricular contractions. The correct answer is 2. Increased urine output. Rationale. Furosemide is a loop diuretic that acts to increase urine output. Furosemide does not increase blood pressure, decrease pain, or decrease arrhythmias.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which is a recommended guideline for safe computerized charting? 1. Passwords to the computer system should only be changed if lost. 2. Computer terminals may be left unattended during client care activities. 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. 4. Copies of printouts from computerized files should be kept on a clipboard at the nurse's station for other nurses to access. The correct answer is 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. After any inadvertent deletions of permanent computerized records, the nurse should type an explanation into the computer file with the date, time, and his or her initials. The nurse should also contact the nursing manager or supervisor with a written explanation of the situation. Options 1, 2, and 4 represent unsafe charting actions. Only option 3 follows the guidelines for safe computer charting.
A patient is scheduled for endoscopic carpal tunnel release surgery in the morning. What would the nurse be sure to teach the patient? 1. Pain and numbness are expected to be experienced for several days to weeks. 2. Immediately after surgery, the patient will no longer need assistance. 3. After surgery, the dressing will be large and there will be lots of drainage. 4. The patient's pain and paresthesia will no longer be present. The correct answer is 1. Pain and numbness are expected to be experienced for several days to weeks. Rationale. Postoperative pain and numbness occur for a longer period of time with endoscopic carpal tunnel release than with an open procedure. Patients often need assistance post-operatively, even after they are discharged. The dressing from the endoscopic procedure is usually very small, and there should not be a lot of drainage.
Which of the following physical sensations will the client who has had an abdominal hysterectomy most likely experience if she hyperventilates while performing deep breathing exercises? 1. Dyspnea. 2. Dizziness. 3. Blurred vision. 4. Mental confusion. The correct answer is 2. Dizziness. Hyperventilation occurs when the client breathes so rapidly and deeply that she exhales excessive amounts of carbon dioxide. A characteristic symptom of hyperventilation is dizziness. To avoid hyperventilation, the nurse should assist the client in the practice of slow, deep breathing in a regular breathing pattern. Dyspnea, blurred vision, and mental confusion are not associated with hyperventilation. The nurse is unable to palpate the client's left pedal pulses. Which of the following actions should the nurse take next? 1. Auscultate the pulses with a stethoscope. 2. Call the physician. 3. Use a Doppler ultrasound device. 4. Inspect the lower left extremity. The correct answer is 3. Use a Doppler ultrasound device. When pedal pulses are not palpable, the nurse should obtain a Doppler ultrasound device. Auscultation is not likely to be helpful if the pulse isn't palpable. Inspection of the lower extremity can be done simultaneously when palpating, but the nurse should first try to locate a pulse by Doppler. Calling the physician may be necessary if there is a change in the client's condition. The nurse is teaching a client about risk factors associated with atherosclerosis and how to reduce the risk. Which of the following is a risk factor that the client is not able to modify? 1. Diabetes. 2. Age. 3. Exercise level. 4. Dietary preferences. The correct answer is 2. Age. Age is a non-modifiable risk factor for atherosclerosis. The nurse instructs the client to manage modifiable risk factors such as comorbid diseases, such as diabetes, activity level, and diet. Controlling serum blood glucose levels, engaging in regular aerobic activity, and choosing a diet low in saturated fats can reduce the risk of developing atherosclerosis. A 36-year-old female client has been diagnosed with hemorrhoids. Which of the following factors in the client's history would most likely be a primary cause of her hemorrhoids? 1. Her age. 2. 3 vaginal delivery pregnancies. 3. Her job as a school teacher. 4. Varicosities in her legs. The correct answer is 2. 3 vaginal delivery pregnancies. Hemorrhoids are associated with prolonged sitting or standing, portal hypertension, chronic constipation, and prolonged increased intra-abdominal pressure as associated with pregnancy and the strain of vaginal delivery. Her job as a school teacher does not require prolonged sitting or standing. Age and leg varicosities are not related to the development of hemorrhoids. The home health nurse is obtaining a history for a patient who has deep vein thrombosis and is taking warfarin 2 mg per day. Which statement by the patient is the best indicator that additional teaching about warfarin may be needed? 1. I have started to eat more healthy foods like green salads and fruit. 2. The doctor said that it is important to avoid becoming constipated. 3. Warfarin makes me feel a little nauseated unless I take it with food. 4. I will need to have some blood testing done once or twice a week. The correct answer is 1. I have started to eat more healthy foods like green salads and fruit. Patients taking warfarin are advised to avoid making sudden dietary changes because changing the oral intake of foods high in vitamin K will have an impact on the effectiveness of the medication. The other statements suggest that further teaching may be indicated, but more assessment for teaching needs is required first. Which task is most appropriate for the nurse to delegate to an unlicensed assistive personnel? 1. Feed a client who is post-operative tonsillectomy the first meal of clear liquids. 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. 3. Obtain a throat culture on a client diagnosed with bacterial pharyngitis. 4. Escort the client diagnosed with laryngitis outside to smoke a cigarette. The correct answer is 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. Clients with colds are encouraged to drink 2,000 milliliters of liquids a day. The UAP could do this. Tonsillectomies cause throat edema and difficulty swallowing. The nurse must observe the client's ability to swallow before this task can be delegated. Throat swabs for culture must be done correctly, or false negative results can occur. The nurse should obtain the swab. Clients with laryngitis are instructed not to smoke. Smoking is discouraged in all healthcare facilities. Sending nursing personnel outside encourages an unhealthy practice, which is not the best use of the personnel. Interventions requiring assessment, teaching, and evaluation cannot be delegated. Levels of activities being delegated should be appropriate for the level of training of the staff member carrying out the task. Tasks delegated must conform to safe healthcare practice. The client calls the clinic and says, "I am having chest pain. I think I'm having another heart attack." Which intervention should the nurse implement first? 1. Call 911 Emergency Medical Services. 2. Instruct the client to take an aspirin. 3. Determine if the client is at home alone. 4. Ask if the client has any sublingual nitroglycerin. The correct answer is 4. Ask if the client has any sublingual nitroglycerin. Because the client has had one MI, the client may have sublingual nitroglycerin, a coronary vasodilator, in a pocket and can take it immediately. If the client does not have any on the body, then the nurse should determine if there is anyone in the home that can help the client.
A woman of African descent had experienced severe palpitations, weakness, and shortness of breath after taking bacitracin. As a part of the discharge planning, the nurse should evaluate the client's knowledge about 1. Increased folic acid needs. 2. Congenital enzyme deficiency. 3. Restricted activity in hot weather. 4. Need for blood transfusions. The correct answer is 2. This client presented with the typical signs of glucose 6-phosphate dehydrogenase, aka G6PD, deficiency anemia. 10% of blacks inherit an X-linked recessive disorder of the G6PD enzyme in the red blood cell. When cells with decreased levels of G6PD are exposed to certain drugs, such as sulfonamides, acetylsalicylic acid, thiazide diuretics, and vitamin K, the RBC may hemolyze and anemia and jaundice may occur. The reaction is self-limited as soon as the causative agent is withheld. No further treatment is necessary except counseling to prevent acute incidents by avoiding exposure to specific drugs. There is no need for increased folic acid, restricted activity in hot weather, or blood transfusions.
Amoxicillin trihydrate 300 mg PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 mg per 5 milliliters. How many milliliters should the nurse administer? Blank milliliters. The correct answer is 6 milliliters. To solve this problem, you set up the formula as 250 milligrams over 5 milliliters equals to 300 milligrams over X. You cross-multiply 250 times X and 300 times 5. You get 250X equals to 1,500. You divide 200 on both sides, and you get X equals to 6 milliliters. This is the amount that the nurse should administer for each dose.
A client has had a pulmonary artery catheter inserted. In performing hemodynamic monitoring with a catheter, the nurse will wedge the catheter to gain information about which of the following? 1. Cardiac output. 2. Right atrial blood flow. 3. Left end diastolic pressure. 4. Cardiac index. The correct answer is 3. Left end diastolic pressure. Rationale. When wedged, the catheter is pointing indirectly at the left end diastolic pressure. The pulmonary artery wedge pressure is measured when the tip of the catheter is slowing inflated and allowed to wedge into a branch of the pulmonary artery. Once the balloon is wedged, the catheter reads the pressure in front of the balloon. During diastole, the mitral valve is open, reflecting left ventricular end diastolic pressure. Cardiac output is the amount of blood ejected by the heart in 1 minute and is determined through thermodilution and not wedge pressure. Cardiac index is calculated by dividing the client's cardiac output by the client's body surface area and is considered a more accurate reflection of the individual client's cardiac output. Right atrial blood pressure is not measured with the pulmonary artery catheter.
An anxious patient repeatedly uses the call bell to get the nurse to come to the room. Finally, the nurse says to the patient, "If you keep ringing, there will come a time I won't answer your bell." Which legal term is related to this statement? 1. Slander. 2. Battery. 3. Assault. 4. Libel. The correct answer is 3. Assault. This scenario is an example of assault. Assault is a verbal attack or unlawful threat causing a fear of harm. No actual contact is necessary for a threat to be an assault. Slander is a falsely spoken statement resulting in damage to a person's character or reputation. Battery is the unlawful touching of a person's body without consent. Libel is a false printed statement resulting in damage to a person's character or reputation.
The charge nurse assigns the nursing care of a patient who has just returned from open carpal tunnel release surgery to an experienced LPN/LVN. Which instructions would the charge nurse provide for the LPN/LVN? Select all that apply. 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. 4. The patient will no longer need pain medication. 5. Check the neurovascular status of the fingers every hour. 6. Instruct the patient to perform range of motion on the affected wrist. The correct answers are 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. And 5. Check the neurovascular status of the fingers every hour. Rationale. Post-operatively, patients undergoing open carpal tunnel release surgery experience pain and numbness, and their discomfort may last for weeks to months. Hand movements may be restricted for 4 to 6 weeks after surgery. All of the other directions are appropriate for the postoperative care of this patient. It is important to monitor for drainage, tightness, and neurovascular changes. Raising the hand and wrist above the heart reduces the swelling from surgery, and this is often done for several days.
Which nursing measure would most likely relieve post-operative gas pains after abdominal hysterectomy? 1. Offering the client a hot beverage. 2. Providing extra warmth. 3. Applying a snugly fitting abdominal binder. 4. Helping the client walk. The correct answer is 4. Helping the client walk. The discomfort associated with gas pains is likely to be relieved when the client ambulates. The gas will be more easily expelled with exercise. The anesthesia, analgesics, and immobility have altered normal peristalsis. Peristalsis will be stimulated by exercise. Offering a hot beverage, providing extra warmth, and applying an abdominal binder are not recommended and could aggravate the discomfort of post-operative gas pains. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which patients would be best to assign to the most experienced nurse in an ambulatory care center that specializes in vision problems and eye surgery? Select all that apply. 1. Patient who requires post-operative instructions after cataract surgery. 2. Patient who needs an iPad and a metal shield applied. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 4. Patient who needs teaching about self-administration of eye drop. 5. Patient who requires an assessment for recent and sudden loss of sight. 6. Patient who requires preoperative teaching for laser trabeculoplasty. The correct answers are 1. Patient who requires post-operative instructions after cataract surgery. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 5. Patient who requires an assessment for recent and sudden loss of sight. And 6. Patient who requires preoperative teaching for laser trabeculoplasty. Providing post-operative and preoperative instructions, making home health referrals, and assessing for needs related to loss of vision should be done by an experienced nurse who can give specific details and specialized information about follow-up eye care and adjustment to loss. The principles of applying an iPad and shield and teaching the administration of eye drops are basic procedures that should be familiar to all nurses. A nursing student is assisting an older patient who has decreased vision related to macular degeneration. The patient is alert, conversant, and cognitively intact. When would the supervising nurse intervene? 1. Student puts the call bell and personal items within reach and locates each item by guiding the patient's hand. 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. 3. Student talks to the patient about family and asks, "So, when was the last time that you saw your uncle?" 4. Student assists during mealtime by opening packages and describing location of foods by using clock coordinates. The correct answer is 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. For patients who retain some vision, the room should be well lit. Even at night, there should be a nightlight. Other options are correct actions. Words such as see, look, or view are parts of normal speech, and it's acceptable and natural to use these terms.
When beginning IV erythropoietin therapy, the nurse should do which of the following? Select all that apply. 1. Check the hemoglobin levels before administering subsequent doses. 2. Shake the vial thoroughly to mix the concentrated white, milky solution. 3. Keep the multi-dose vial refrigerated between scheduled twice-a-day doses. 4. Administer medication through the IV line without other medications. 5. Adjust the initial doses according to the client's changes in blood pressure. 6. Instruct the client to avoid driving and performing hazardous activity during the initial treatment. The correct answers are 4, 5, and 6. Erythropoietin is administered to decrease the need for blood transfusions by stimulating red blood cell production. The medication should be administered through the IV line without other medications to avoid a reaction. The hematocrit, a simple measurement of the percentage of RBCs in the total blood volume, is used to monitor this therapy. When initiating IV erythropoietin therapy, the nurse should monitor the hematocrit level so that it rises no more than 4 points in any 2-week period. In addition, the initial doses of erythropoietin are adjusted according to the client's changes in blood pressure. The nurse should tell the client to avoid driving and performing hazardous activity during the initial treatment due to possible dizziness and headaches secondary to the adverse effect of hypertension. The hematocrit, not the hemoglobin level, is used for monitoring the effectiveness of therapy. The vial of erythropoietin should not be shaken because it may be biologically inactive. The solution should not be used if it is discolored. The nurse should not re-enter the vial once it has been entered. It is a one-time use vial. All remaining erythropoietin should be discarded since it does not contain preservatives.
A client is admitted to the hospital after vomiting bright red blood and is diagnosed with a bleeding duodenal ulcer. The client develops a sudden sharp pain in the mid-epigastric region along with a rigid, board-like abdomen. The nurse should do which of the following first? 1. Administer pain medication as prescribed. 2. Raise the head of the bed. 3. Prepare to insert a nasogastric tube. 4. Notify the physician. The correct answer is 4. Notify the physician. The client is experiencing a perforation of the ulcer, and the nurse should notify the physician immediately. The body reacts to perforation of an ulcer by immobilizing the area as much as possible. This results in board-like abdominal rigidity, usually with extreme pain. Perforation is a medical emergency requiring immediate surgical intervention because peritonitis develops quickly after perforation. Administering pain medication is not the first action, although the nurse later should institute measures to relieve pain. Elevating the head of the bed will not minimize perforation. A nasogastric tube may be used following surgery.
When monitoring a client who is receiving tissue plasminogen activator, TPA, the nurse should have resuscitation equipment available because reperfusion of the cardiac tissue can result in which of the following? 1. Cardiac arrhythmias. 2. Hypertension. 3. Seizure. 4. Hypothermia. The correct answer is 1. Cardiac arrhythmias. Rationale. Cardiac arrhythmias are commonly observed with administration of TPA. Cardiac arrhythmias are associated with reperfusion of the cardiac tissue. Hypotension is commonly observed with administration of TPA. Seizures and hypothermia are not generally associated with reperfusion of the cardiac tissue.
The nurse is caring for the pregnant client in labor. The client has had no prenatal care and reports being dependent on opioids throughout her pregnancy. Which interventions for pain control could be provided to this client? Select all that apply. 1. Epidural anesthesia. 2. Budorphanol IV. 3. Morphine IV. 4. Acetaminophen PO. 5. 1% lidocaine locally. The correct answers are 1. Epidural anesthesia. 3. Morphine IV. 4. Acetaminophen PO. And 5. 1% lidocaine locally. Epidural anesthesia is not contraindicated in the opioid-dependent client and is an acceptable form of pain management. If narcotics can be safely administered, the nurse should not withhold the medication during labor. Giving opioids during acute pain does not enhance an opioid-addicted client's chemical dependence. Acetaminophen administered orally can reduce pain in early labor. 1% lidocaine can be administered by the HCP prior to an episiotomy or for perineal repair. But Budorphanol is a narcotic agonist-antagonist and should be avoided in the opioid-dependent client as it can cause acute withdrawal in the mother and in utero withdrawal in the fetus, characterized by fetal tachycardia and fetal death.
A patient with a right above the knee amputation asked the nurse why he has phantom limb pain. What is the nurse's best response? 1. Phantom limb pain is not explained or predicted by any one theory. 2. Phantom limb pain occurs because your body thinks your leg is still present. 3. Phantom limb pain will not interfere with your activities of daily living. 4. Phantom limb pain is not real pain but is remembered pain. The correct answer is 1. Phantom limb pain is not explained or predicted by any one theory. Rationale. 3 theories are being researched with regard to phantom limb pain. The peripheral nervous system theory suggests that sensations remain as a result of the severing of peripheral nerves during the amputation. The central nervous system theory states that phantom limb pain results from a loss of inhibitory signals that were generated through afferent impulses from the amputated limb. The psychological theory helps predict and explain phantom limb pain because stress, anxiety, and depression often trigger or worsen a pain episode.
A client with colon cancer is having a barium enema. The nurse should instruct the client to take which of the following after the procedure is completed? 1. Laxative. 2. Anticholinergic. 3. Antacid. 4. Demulcent. The correct answer is 1. Laxative. After a barium enema, a laxative is ordinarily prescribed. This is done to promote elimination of the barium. Retained barium predisposes the client to constipation and fecal impaction. Anticholinergic drugs decrease gastrointestinal motility. Antacids decrease gastric acid secretion. Demulcents soothe mucous membranes of the gastrointestinal tract and are used to treat diarrhea. Which of these patients who have just arrived at the emergency department should the nurse assess first? 1. Patient who reports several dark tarry stools and a history of peptic ulcer disease. 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. 3. Patient who has pernicious anemia and reports paresthesia of the hands and feet. 4. Patient with thalassemia major who needs a scheduled blood transfusion. The correct answer is 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. Thigh swelling after an injury in a patient with hemophilia likely indicates acute bleeding, which can compromise blood flow and nerve function in the leg, and should be treated immediately with the administration of factor replacement. The other patients also need assessment, treatment, or both, but the data do not indicate any immediate threat to life or function. The home healthcare nurse is talking on the telephone to a male client diagnosed with hypertension and hears the client sneezing. The client tells the nurse he has been blowing his nose frequently. Which question should the nurse ask the client? 1. Have you had the flu shot in the last 2 weeks? 2. Are there any small children in the home? 3. Are you taking over-the-counter medicine for these symptoms? 4. Do you have any cold sores associated with your sneezing? The correct answer is 3. Are you taking over-the-counter medicine for these symptoms? A client diagnosed with hypertension should not take many of the over-the-counter medications because they work by causing vasoconstriction, which will increase the hypertension. Influenza is a viral illness that might cause these symptoms. However, an immunization should not give the client the illness. Coming into contact with small children increases the risk of contracting colds and the flu, but the client has a problem, not just a potential one. Cold sores are actually an infection by the herpes simplex virus. Colds and cold-like symptoms are caused by the rhinovirus or influenza virus. The term cold sore is a common term that still persists in the populace. The keys to answering this question are the words hypertension and cold. Anytime a client has a chronic illness, the client should discuss over-the-counter medications with the healthcare provider or a pharmacist. Many of the routine medications for chronic illnesses interact with over-the-counter medications. A school-age child is admitted to the hospital for a tonsillectomy. During the nurse's post-operative assessment, the child's parent tells the nurse that the child is in pain. Which of the following observations would be of most concern to the nurse? 1. The child's heart rate and blood pressure are elevated. 2. The child complains of having a sore throat. 3. The child is refusing to eat solid foods. 4. The child is swallowing excessively. The correct answer is 4. The child is swallowing excessively. Excessive swallowing is a sign that the child is swallowing blood. This should be considered a medical emergency, and the healthcare provider should be contacted immediately. The child is likely bleeding and will need to return to surgery.
A nurse assesses a 40-year-old female client with vasospastic disorder, Raynaud's phenomenon, involving her right hand. The nurse notes the information in the progress notes. The notes say, the client has a palpable but faint right radial pulse. Capillary refill on 5 digits is less than 8 seconds. No observable swelling. The client is reporting numbness in the tips of all digits. The skin is warm, dry, and red. From these findings, the nurse should develop a plan with the client to first manage. 1. Acute pain. 2. Numbness. 3. Lack of circulation. 4. Potential for skin breakdown. The correct answer is 2. The client has numbness in the fingertips, and the nurse should first help the client regain sensory perception and discuss strategies for prevention of injury. The client does not have acute pain. The client does have adequate circulation and is not at risk for skin breakdown at this time.
When assessing an individual with peripheral vascular disease, which clinical manifestation would indicate complete arterial obstruction in the lower left leg? 1. Aching pain in the left calf. 2. Burning pain in the left calf. 3. Numbness and tingling in the left leg. 4. Coldness of the left foot and ankle. The correct answer is 4. Coldness of the left foot and ankle. Coldness in the left foot and ankle is consistent with complete arterial obstruction. Other expected findings would include paralysis and pallor. Aching pain, a burning sensation, or numbness and tingling are earlier signs of tissue hypoxia and ischemia and are commonly associated with incomplete obstruction. In the care of a patient who recently sustained blindness, which tasks would be delegated to assistive personnel? Select all that apply. 1. Counseling the patient to express grief or loss. 2. Assisting the patient with ambulating in the hall. 3. Orienting the patient to the surroundings. 4. Encouraging independence. 5. Obtaining supplies for hygienic care. 6. Storing personal items to reduce clutter. The correct answers are 2. Assisting the patient with ambulating in the hall, and 5. Obtaining supplies for hygienic care. Assisting the patient with ambulating in the hall and obtaining supplies are within the scope of practice of the AP. Counseling for emotional problems, orienting the patient to the room, and encouraging independence require formative evaluation to gauge readiness, and these activities should be the responsibility of the nurse. Storing items and rearranging furniture are inappropriate actions because the patient needs to be able to consistently locate objects in the immediate environment. The home health nurse discovers that an older patient has been taking her glaucoma eye drops by mouth for the past week. What should the nurse do first? 1. Obtain a prescription for tonometry so that her intraocular pressure can be checked. 2. Try to determine the frequency and the amount that she has been ingesting. 3. Ask her how she decided to take the drops orally instead of instilling them as eye drops. 4. Call the Poison Control Center and be prepared to describe untoward side effects. The correct answer is 2. Try to determine the frequency and the amount that she has been ingesting. Try to find out the amount and frequency that she has been taking the drops by mouth. This information will be needed when calling the ophthalmologist or poison control. A good follow-up question is to try to find out why she is taking the drops by mouth. She may be very confused, or there may have been an error of omission in patient education by all healthcare team members who were involved in the initial prescription. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When obtaining a nursing history from a client with a suspected gastric ulcer, which signs and symptoms should the nurse assess? Select all that apply. 1. Epigastric pain at night. 2. Relief of epigastric pain after eating. 3. Vomiting. 4. Weight loss. 5. Melena. The correct answers are 3. Vomiting, 4. Weight loss, and 5. Melena. Vomiting and weight loss are common with gastric ulcers. The client may also have blood in the stools, which is melena from gastric bleeding. Clients with a gastric ulcer are most likely to have a burning epigastric pain that occurs about 1 hour after eating. Eating frequently aggravates the pain. Clients with duodenal ulcers are more likely to have pain that occurs during the night and is frequently relieved by eating.
Prior to administering tissue plasminogen activator, TPA, the nurse should assess the client for which of the following contradictions to administering the drug? 1. Age greater than 60 years. 2. History of cerebral hemorrhage. 3. History of heart failure. 4. Cigarette smoking. The correct answer is 2. History of cerebral hemorrhage. Rationale. A history of cerebral hemorrhage is a contraindication to administration of TPA because the risk of hemorrhage may be further increased. Age greater than 60 years, history of heart failure, and cigarette smoking are not contraindications.
The nurse is teaching a pregnant client diagnosed with tuberculosis infection about treatments during pregnancy and effects on her newborn. Which statement indicates the client understands the client teaching? 1. My baby will be born with TB and will be given isoniazid to treat the infection. 2. I will not be able to breastfeed, or my newborn could contract TB. 3. I should take supplemental pyridoxine during my pregnancy. 4. I will not take any medications to treat my TB until I have delivered my baby. The correct answer is 3. I should take supplemental pyridoxine during my pregnancy. Pyridoxine is recommended for pregnant clients with TB infections to ensure the fetus gets necessary vitamins. The infant will be tested for congenital TB. However, perinatal transmission is rare. Breastfeeding is not contraindicated in latent TB. Isoniazid, rifampin, and ethambutol are taken daily during pregnancy for treatment of TB.
During morning care, a patient with a below-the-knee amputation asked the assistive personnel about prostheses. How will the nurse instruct the AP to respond? 1. You should get a prosthesis so that you can walk again. 2. Wait and ask your healthcare provider that question the next time he comes in. 3. It's too soon to be worrying about getting a prosthesis. 4. I'll ask the nurse to come in and discuss this with you. The correct answer is 4. I'll ask the nurse to come in and discuss this with you. Rationale. The patient is indicating an interest in learning about prostheses. The experienced nurse can initiate discussion and begin educating the patient. Certainly, the HCP can also discuss prostheses with the patient, but the patient's wish to learn should receive a quick response. The nurse can then notify the HCP about the patient's request.
A client has a nasogastric tube inserted at the time of abdominal perineal resection with permanent colostomy for colon cancer. This tube will most likely be removed when the client demonstrates 1. Absence of nausea and vomiting. 2. Passage of mucus from the rectum. 3. Passage of flatus and feces from the colostomy. 4. Absence of stomach drainage for 24 hours. The correct answer is 3. Passage of flatus and feces from the colostomy. A sign indicating that a client's colostomy is open and ready to function is passage of feces and flatus. When this occurs, gastric suction is ordinarily discontinued, and the client is allowed to start taking fluids and food orally. Absence of bowel sounds would indicate that the tube should remain in place because peristalsis has not yet returned. A patient with chemotherapy-related neutropenia is receiving filgrastim injections. Which finding by the nurse is most important to report to the healthcare provider? 1. The patient says, "My bones are aching." 2. The patient's platelet count is 110,000 cubic milliliters. 3. The patient's white blood cell count is 39,000 cubic milliliters. 4. The patient reports that the medication stings when it is injected. The correct answer is 3. The patient's white blood cell count is 39,000 cubic milliliters. Leukocytosis is an adverse effect of filgrastim and indicates a need to stop the medication or decrease dosage. Bone pain is a common adverse effect as the bone marrow starts to produce more neutrophils. The patient should receive analgesics, but the medication will be continued. Stinging with injection may occur. The nurse should administer the medication more slowly. The patient's platelet count is low and should be reported, but the level of 110,000 cubic milliliters does not increase risk for spontaneous bleeding. The school nurse is presenting a class to students at a primary school on how to prevent the transmission of the common cold virus. Which information should the nurse discuss? 1. Instruct the children to always keep a tissue or handkerchief with them. 2. Explain that children current with immunizations will not get a cold. 3. Tell the children they should go to the doctor if they get a cold. 4. Demonstrate to the students how to wash hands correctly. The correct answer is 4. Demonstrate to the students how to wash hands correctly. Hand washing is the single most useful technique for prevention of disease. Colds are caused by a virus, and antibiotics do not treat a virus. Therefore, there is no need to go to a healthcare provider. There is no immunization for the common cold. Colds are actually caused by at least 200 separate viruses, and the viruses mutate frequently. It is not feasible for a child to always have a tissue or handkerchief available. Option 1 contains the word always, an absolute word, and in most questions, absolutes such as always, never, and only make that answer option incorrect. The nurse is reviewing discharge instructions with the parents of a child who had a tonsillectomy a few hours ago. The parents tell the nurse that the child is a big eater and they want to know what foods to give the child for the next 24 hours. What is the nurse's best response? 1. The child's diet should not be restricted at all. 2. The child's diet should be restricted to clear liquids. 3. The child's diet should be restricted to ice cream and cold liquids. 4. The child's diet should be restricted to soft foods. The correct answer is 4. The child's diet should be restricted to soft foods. Soft foods are recommended to limit the child's pain and to decrease the risk for bleeding. You can eliminate answer 1 by knowing there are usually some dietary restrictions following any surgical procedure.
Which of the following clients is at greatest risk for vasospastic disorder, Raynaud's phenomenon? 1. Young women. 2. Old women. 3. Old men. 4. Young men. The correct answer is 1. Vasospastic disorder, Raynaud's disease, is more common in young women and is associated with collagen diseases such as rheumatoid arthritis and lupus.
A client with peripheral vascular disease returns to the surgical care unit after having femoral popliteal bypass grafting. Indicate in which order the nurse should conduct assessment of this client. 1. Post-operative pain. 2. Peripheral pulses. 3. Urine output. 4. Incision site. The correct order is 2. Peripheral pulses. 4. Incision site. 3. Urine output. And 1. Post-operative pain. Because assessment of the presence and quality of the pedal pulses in the affected extremity is essential after surgery to make sure that the bypass graft is functioning, this step should be done first. The nurse should next ensure that the dressing is intact, and then that the client has adequate urine output. Lastly, the nurse should determine the client's level of pain.
A client taking paroxetine, Paxil, 40 milligrams PO every morning tells the nurse that her mouth feels like cotton. Which of the following statements by the client necessitates further assessment by the nurse? 1. I'm sucking on ice chips. 2. I'm using sugarless gum. 3. I'm sucking on sugarless candy. 4. I'm drinking 12 glasses of water every day. The correct answer is 4. I'm drinking 12 glasses of water every day. Rationale. Dry mouth is a common, temporary side effect of paroxetine. The nurse needs to further assess the client's water intake when the client states she is drinking lots of water. Excessive intake of water could be harmful to the client and could lead to electrolyte imbalance. Dry mouth is caused by the medication, and drinking a lot of water will not eliminate it. Sucking on ice chips or using sugarless gum or candy is appropriate to ease the discomfort of dry mouth associated with paroxetine. A client taking mirtazapine is disheartened about a 20 pounds, 9 kilograms, weight gain over the past 3 months. The client tells the nurse, I stopped taking my mirtazapine 15 days ago. I don't want to get depressed again, but I feel awful about my weight. Which response by the nurse is most appropriate? 1. Focusing on diet and exercise alone should control your weight. 2. Your depression is much better now, so your medication is helping you. 3. Look at all the positive things that have happened to you since you started mirtazapine. 4. I hear how difficult this is for you and will help you approach the doctor about it. The correct answer is 4. I hear how difficult this is for you and will help you approach the doctor about it. Rationale. The nurse should express concern for the client and offer to help the client speak with the primary healthcare provider, which will lend support to the client's concerns. The client who has stopped the medication must be taken seriously because medication noncompliance could result in a recurrence of symptoms of depression. Telling the client to focus on diet and exercise ignores the client's feelings and subtly implies the weight gain is the client's fault. Pointing out that the medication has helped and that positive things have happened since the depression lifted may be true, but it does not address the client's current feelings or needs.
Which position would be best for the client in the early post-operative period after a hemorrhoidectomy? 1. High Fowlers. 2. Supine. 3. Side-lying. 4. Trendelenburgs. The correct answer is 3. Side-lying. Positioning in the early post-operative phase should avoid stress and pressure on the operative site. The prone and side-lying positions are ideal from a comfort perspective. A high Fowler's or supine position will place pressure on the operative site and is not recommended. There is no need for Trendelenburg's position. A patient is admitted to the intensive care unit with disseminated intravascular coagulation associated with a gram-negative infection. Which assessment information has the most immediate implications for the patient's care? 1. There is no palpable radial or pedal pulse. 2. The patient reports chest pain. 3. The patient's oxygen saturation is 87%. 4. There is modeling of the hands and feet. The correct answer is 3. The patient's oxygen saturation is 87%. Because the decrease in oxygen saturation will have the greatest immediate effect on all body systems, improvement in oxygenation should be the priority goal of care. The other data also indicate the need for rapid intervention, but improvement of oxygenation is the most urgent need. The nurse is caring for a client diagnosed with a cold, which is an example of an alternative therapy. 1. Vitamin C 2,000 milligrams daily. 2. Strict bed rest. 3. Humidification of the air. 4. Decongestant therapy. The correct answer is 1. Vitamin C 2,000 milligrams daily. Alternative therapies are therapies not accepted as standard medical practice. These may be encouraged as long as they do not interfere with the medical regimen. Vitamin C in large doses is thought to improve the immune system's functions. Bed rest is accepted standard advice for a client with a cold. Humidifying the air helps to relieve congestion and is a standard practice. Decongestant therapy is standard therapy for a cold. Only one of the answer options is not common advice for a client with a cold. When all options but one match each other, then the odd option should be selected as the correct answer. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is administering 0.5 inch of nitroglycerin paste. How much paste should the nurse apply to the application paper? 1. A, 2, B, 3, C, 4, D. The correct answer is 1. A. The line is in increments of 0.5 inch, and the order is 0.5 inch. Therefore, the nurse should apply this much paste.
The nurse is assessing a client's activity tolerance by having the client walk on a treadmill for 5 minutes. Which of the following indicates an abnormal response? 1. Pulse rate increased by 20 beats per minute immediately after the activity. 2. Respiratory rate decreased by 5 breaths per minute. 3. Diastolic blood pressure increased by 7. 4. Pulse rate within 6 beats per minute of resting pulse after 3 minutes of rest. The correct answer is 2. The normal physiologic response activity is an increased metabolic rate over the resting basal rate. The decrease in respiratory rate indicates that the client is not strong enough to complete the mechanical cycle of respiration needed for gas exchange. The post-activity pulse is expected to increase immediately after activity, but by no more than 50 beats per minute if it is strenuous activity. The diastolic blood pressure is expected to rise, but by no more than 15. The pulse returns to within 6 beats per minute of the resting pulse after 3 minutes of rest.
During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. Encourage the client to suck on hard candy. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, inflammation of the mouth, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and the nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occur during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is the priority at this time.
After a myocardial infarction, the hospitalized client is taught to move the legs while resting in bed. The expected outcome of this exercise is to 1. Prepare the client for ambulation. 2. Promote urinary and intestinal elimination. 3. Prevent thrombophlebitis and blood clot formation. 4. Decrease the likelihood of pressure ulcer formation. The correct answer is 3. Prevent thrombophlebitis and blood clot formation. Rationale. Encouraging the client to move the legs while in bed is a preventive strategy taught to all clients who are hospitalized and on bed rest to promote venous return. The muscular action aids in venous return and prevents venous stasis in the lower extremities. These exercises are not intended to prepare the client for ambulation. These exercises are not associated with promoting urinary and intestinal elimination. These exercises are not performed to decrease the risk of pressure ulcer formation.
Which medication categories are contraindicated in clients who are pregnant? Select all that apply. 1. Pregnancy category A. 2. Pregnancy category B. 3. Pregnancy category C. 4. Pregnancy category D. 5. Pregnancy category X. The correct answers are 4. Pregnancy category D and 5. Pregnancy category X. Category D medications have a proven risk of fetal harm and are not prescribed for clients who are pregnant unless the mother's life is in danger. Category X medications have a definite risk of fetal abnormality or abortion. Category A medications have a remote risk of causing fetal harm and are prescribed for clients who are pregnant. Category B medications have a slightly higher risk of causing fetal abnormalities than do Category A medications, but they are often prescribed for clients who are pregnant. Category C medications pose a greater risk than Category B medications and are cautiously prescribed for clients who are pregnant. Medications in this category have either not yet been the subject of research or may show a risk in animal studies.
The nurse is preparing a patient who had carpal tunnel release surgery for discharge. Which information is important to provide for this patient? 1. The surgical procedure is a cure for carpal tunnel syndrome. 2. Do not lift any heavy objects. 3. Frequent doses of pain medication will no longer be necessary. 4. The healthcare provider should be notified immediately if there is any pain or discomfort. The correct answer is 2. Do not lift any heavy objects. Rationale. Hand movements, including heavy lifting, may be restricted for 4 to 6 weeks after surgery. Patients experience discomfort for weeks to months after surgery. The surgery is not always a cure. In some cases, CTS may recur months to years after surgery.
On the second post-operative day after an abdominal hysterectomy, the client develops a temperature of 100.4 degrees Fahrenheit. The nurse's first action should be to 1. Increase the number of wound changes to minimize infection. 2. Obtain a culture and sensitivity study of the urine to determine the source of infection. 3. Ensure that the client takes at least 10 deep breaths every hour. 4. Change the site of the client's IV fluid catheter to reduce the risk of infection. The correct answer is 3. Ensure that the client takes at least 10 deep breaths every hour. Elevated temperature on the second post-operative day is suggestive of a respiratory tract infection. Respiratory infections most often occur during the first 48 hours after surgery. The client's vital signs should be monitored closely, and abnormalities should be reported to the surgeon. Signs of infection, if present in the wound or urinary tract, are likely to occur later in the post-operative period. There is no indication that the IV catheter is the source of infection. The nurse is preparing to administer a beta-adrenergic blocking glaucoma agent. Which statement made by the patient warrants additional assessment and a notification to the healthcare provider? 1. My blood pressure runs a little high if I gain too much weight. 2. Occasionally, I have palpitations, but they pass very quickly. 3. My joints feel stiff today, but that's just my arthritis. 4. My pulse rate is a little low today because I take digoxin. The correct answer is 4. My pulse rate is a little low today because I take digoxin. All beta-adrenergic blockers are contraindicated in bradycardia. Alpha-adrenergic agents can cause tachycardia and hypertension. Carbonic anhydrase inhibitors should not be given to patients with rheumatoid arthritis who are taking high dosages of aspirin.
When developing a teaching plan for a client about the medications prescribed for depression, which of the following components is most important for the nurse to include? 1. Pharmacokinetics of the medication. 2. Current research related to the medication. 3. Management of common adverse effects. 4. Dosage regulation and adjustment. The correct answer is 3. Management of common adverse effects. Rationale. Compliance with medication therapy is crucial for the client with depression. Medication noncompliance is the primary cause of relapse among psychiatric clients. Therefore, the nurse needs to teach the client about managing common adverse effects to promote compliance with medication. Teaching the client about the medication's pharmacokinetics may help the client to understand the reason for the drug. However, teaching about how to manage common adverse effects to promote compliance is crucial. Current research about the medication is more important to the nurse than to the client. Teaching about dosage regulation and adjustment of medication may be helpful, but typically the primary healthcare provider, not the client, is the person in charge of this aspect. The primary healthcare provider prescribes mirtazapine, Remeron, 30 milligrams PO at bedtime for a client diagnosed with depression. The nurse should 1. Give the medication as prescribed. 2. Question the primary healthcare provider's prescription. 3. Request to give the medication in the morning. 4. Give the medication in 3 divided doses. The correct answer is 1. Give the medication as prescribed. Rationale. The nurse should give the medication as prescribed. Mirtazapine is given once daily, preferably at bedtime, to minimize the risk of injury resulting from postural hypotension and sedative effects. The usual dosage ranges from 15 to 45 milligrams. There is no reason to question the primary healthcare provider's prescriptions. The nurse should administer the medication as prescribed. Requesting to give the medication in 3 divided doses is inappropriate and demonstrates the nurse's lack of knowledge about the drug.
A patient with iron deficiency anemia who is taking oral iron supplements is evaluated by the nurse in the outpatient clinic. Which finding by the nurse is of most concern? 1. The patient reports that stools are black. 2. The patient complains of occasional constipation. 3. The patient takes a multivitamin tablet every day. 4. The patient takes an antacid with the iron to avoid nausea. The correct answer is 4. The patient takes an antacid with the iron to avoid nausea. Concurrent use of antacids with iron supplements will decrease absorption of the iron and decrease the efficacy in resolving the patient's anemia. Black stools are expected when taking oral iron. The patient's occasional constipation may indicate a need for information about prevention of constipation while taking iron. Use of a multivitamin tablet is safe when taking iron supplements. The nurse is assessing a 79-year-old client diagnosed with pneumonia. Which signs and symptoms should the nurse expect to assess in the client? 1. Confusion and lethargy. 2. High fever and chills. 3. Frothy sputum and edema. 4. Bradypnea and jugular vein distension. The correct answer is 1. Confusion and lethargy. The elderly client diagnosed with pneumonia may present with weakness, fatigue, lethargy, confusion, and poor appetite, but not have any of the classic signs and symptoms of pneumonia. Fever and chills are classic symptoms of pneumonia, but they are usually absent in the elderly client. Frothy sputum and edema are signs and symptoms of heart failure, not pneumonia. The client has tachypnea, not bradypnea, and jugular vein distension accompanies heart failure. The client diagnosed with coronary artery disease is prescribed atorvastatin. Which statement by the client warrants the nurse notifying the HCP? 1. I really haven't changed my diet, but I am taking my medication every day. 2. I am feeling pretty good, except I am having muscle pain all over my body. 3. I am swimming at the local pool about 3 times a week for 30 minutes. 4. I am taking this medication first thing in the morning with a bowl of oatmeal. The correct answer is 2. I am feeling pretty good, except I am having muscle pain all over my body. Atorvastatin is an HMG-CoA reductase inhibitor, or a statin. Statins can cause muscle injury, which can lead to myositis, fatal rhabdomyolysis, or myopathy. Muscle pain or tenderness should be reported to the HCP immediately. Usually the medication is discontinued.
In a postoperative client, the hematocrit decreased from 36% to 34% on the third day, even though the red blood cell count and hemoglobin value remained stable at 4.5 millions per microliter and 11.9 grams per deciliter, respectively. The nurse should next 1. Check the dressing and drains for frank bleeding. 2. Call the physician. 3. Continue to monitor vital signs. 4. Start oxygen at 2 liters per minute per nasal cannula. The correct answer is 3. The nurse should continue to monitor the client because this value reflects a normal physiologic response. The physician does not need to be called, and oxygen does not need to be started based on these laboratory findings. Immediately after surgery, the client's hematocrit reflects a falsely high value related to the body's compensatory response to the stress of sudden loss of fluids and blood. Activation of the intrinsic pathway and the renin-angiotensin cycle via antidiuretic hormone produces vasoconstriction and retention of fluid for first 1 to 2 days postoperatively. By the 2nd to 3rd day, this response decreases, and the client's hematocrit level is more reflective of the amount of RBCs in the plasma. Fresh bleeding is a less likely occurrence on the 3rd postoperative day, but is not impossible. However, the nurse should have expected to see a decrease in the RBC count and hemoglobin value accompanying the hematocrit.
The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Use of alcohol. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation, such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun, lip cancer, and syphilis. Use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Which of the following is the most appropriate diet for a client during the acute phase of myocardial infarction? 1. Liquids as desired. 2. Small, easily digested meals. 3. 3 regular meals per day. 4. Nothing by mouth. The correct answer is 2. Small, easily digested meals. Rationale. Recommended dietary principles in the acute phase of MI include avoiding large meals because small, easily digested foods are better tolerated. Fluids are given according to the client's needs, and sodium restrictions may be prescribed, especially for clients with manifestations of heart failure. Cholesterol restrictions may be prescribed as well. Clients are not prescribed diets of liquids only or restricted to nothing by mouth unless their condition is very unstable.
The client who is pregnant is prescribed ferrous sulfate. Which statement indicates to the nurse the client needs more teaching? 1. I should increase my fluid intake and fiber when taking this medication. 2. I will take a daily stool softener to prevent becoming constipated. 3. If I notice that my stool becomes black or dark, I will call my obstetrician. 4. I should take my iron tablet 2 hours after I eat. The correct answer is 3. If I notice that my stool becomes black or dark, I will call my obstetrician. Ferrous sulfate, an iron product, causes the stool to become black and tarry. Therefore, the client would not need to notify the obstetrician. The client should increase fluid and fiber to help decrease the possibility of becoming constipated. The client is instructed to take a daily stool softener to prevent constipation. Iron should be taken between meals, 2 hours after a meal, because food decreases absorption of the medication by 50% to 70%.
The nurse is providing care for a patient with a rotator cuff tear. What treatment does the nurse expect the healthcare provider will prescribe first for this patient? 1. Arthroscopic repair of the rotator cuff tear. 2. Elimination of movements in the affected shoulder. 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. 4. Pendulum exercises that start slow and progress over 2 weeks. The correct answer is 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. Rationale. For the patient with a torn rotator cuff, the HCP usually treats the patient conservatively with NSAIDs, intermittent steroid injections, physical therapy, and activity limitations while the tear heals. Physical therapy treatments may include ultrasound, electrical stimulation, ice, and heat.
The nurse is changing the dressing of a client after an abdominal hysterectomy. Which of the following nursing measures would be most appropriate if the dressing adheres to the client's incisional area? 1. Pull off the dressing quickly and then apply slight pressure over the area. 2. Lift an easily moved portion of the dressing and then remove it slowly. 3. Moisten the dressing with sterile normal saline solution and then remove it. 4. Remove part of the dressing and then remove the remainder gradually over a period of several minutes. The correct answer is 3. Moisten the dressing with sterile normal saline solution and then remove it. When a dressing sticks to a wound, it is best to moisten the dressing with sterile normal saline solution and then remove it carefully. Trying to remove a dry dressing is likely to irritate the skin and wound. This may contribute to tension or tearing along the suture line. The nurse is supervising a new nurse who has just finished assessing a patient for redness and discomfort to the right eye. The new nurse documents Visual Acuity NA. Which action would the supervising nurse take? 1. Do nothing. The documentation is minimal but acceptable. 2. Ask her to explain the rationale for the documentation. 3. Reassess the patient's eye and vision to validate findings. 4. Suggest contacting the clinical educator for documentation tips. The correct answer is 2. Ask her to explain the rationale for the documentation. Asking the nurse to explain the documentation is a way of assessing her knowledge of documentation, her understanding of how the patient's report guides the focused assessment, and her understanding of the use of abbreviations. The nurse may have a good reason for charting NA, but a reader could misunderstand. For example, Visual Acuity NA could be interpreted as the nurse making a clinical judgment that assessing vision was not applicable for this patient. The documentation is not acceptable because the patient's report indicates that vision should be tested if at all possible. Redoing the assessment does not help the nurse to correct mistakes. Contacting the educator for assistance is an option that is based on assessment of her rationale. The client diagnosed with partial and full thickness burns to 35% of the body is admitted to the burn department. The HCP has prescribed famotidine. Which statement best describes the scientific rationale for administering this medication? 1. Famotidine acts on the cell wall to prevent bacterial growth. 2. Famotidine will help control the client's pain. 3. Famotidine will help decrease the client's nausea and vomiting. 4. Famotidine will help decrease gastric acid production. The correct answer is 4. Famotidine will help decrease gastric acid production. Curling's ulcer is an acute ulceration of the stomach or duodenum that forms following a burn injury. Histamine 2 antagonists like famotidine are administered to decrease gastric acid secretion in the acute phase of burn care. Silver sulfadiazine, a topical antimicrobial, not famotidine, acts on the cell membrane and cell wall of susceptible bacteria and binds to cellular DNA. IV opioid medications, not famotidine, will help decrease the client's pain. Antiemetics, not famotidine, will help prevent the client's nausea and vomiting. The client diagnosed with a partial thickness burn to the entire right leg who is being treated with silver sulfadiazine develops leukopenia. Which medication should the nurse expect the HCP to prescribe? 1. Discontinue the silver sulfadiazine ointment immediately. 2. Continue administering the silver sulfadiazine ointment. 3. Administer aminoglycoside antibiotics intravenously. 4. Administer hydrocortisone cream to the burned area. The correct answer is 2. Continue administering the silver sulfadiazine ointment. Silver sulfadiazine is a sulfonamide antibacterial agent. Many clients develop marked leukopenia in response to silver sulfadiazine. The leukopenia will improve spontaneously over the course of treatment. Leukopenia does not contraindicate use of this medication. Leukopenia improves over the course of the treatment with silver sulfadiazine and does not warrant discontinuing the medication. Leukopenia, secondary to silver sulfadiazine therapy, does not warrant the administration of aminoglycoside antibiotics. Hydrocortisone cream does not treat leukopenia secondary to silver sulfadiazine. The nurse is caring for a client who has had a gastroscopy. Which of the following may indicate that the client is developing a complication related to the procedure? Select all that apply. 1. The client has a sore throat. 2. The client has a temperature of 100 degrees Fahrenheit. 3. The client appears drowsy following the procedure. 4. The client has epigastric pain. 5. The client experiences hematemesis. The correct answers are 2. The client has a temperature of 100 degrees Fahrenheit. 4. The client has epigastric pain. And 5. The client experiences hematemesis. Following a gastroscopy, the nurse should monitor the client for complications, which include perforation and the potential for aspiration. An elevated temperature, epigastric pain, or the vomiting of blood are all indications of a possible perforation and should be reported promptly. A sore throat is a common occurrence following a gastroscopy. Clients are usually sedated to decrease anxiety, and the nurse would anticipate that the client will be drowsy following the procedure.
A client has driven himself to the emergency department. He is 50 years old, has a history of hypertension, and informs the nurse that his father died from a heart attack at age 60. The client has indigestion. The nurse connects him to an electrocardiogram monitor and begins administering oxygen at 2 liters per minute per nasal cannula. The nurse's next action should be to 1. Call for the physician. 2. Start an IV infusion. 3. Obtain a portable chest radiograph. 4. Draw blood for laboratory studies. The correct answer is 2. Start an IV infusion. Rationale. Advanced Cardiac Life Support recommends that at least 1 or 2 IV lines be inserted in one or both of the anticubal spaces. Calling the physician, obtaining a portable chest radiograph, and drawing blood for the laboratory are important but secondary to starting the IV line.
The nurse is assisting the certified registered nurse anesthetist in placing an epidural in a laboring client. Which findings would indicate intravascular injection of the local anesthetic? Select all that apply. 1. Tachycardia. 2. Pruritus. 3. Tinnitus. 4. Sedation. 5. Dizziness. The correct answers are 1. Tachycardia, 3. Tinnitus, and 5. Dizziness. Tachycardia is a symptom of intravascular injection of a local anesthetic. Tinnitus is a symptom of intravascular injection of a local anesthetic. Dizziness is a symptom of intravascular injection of a local anesthetic. Pruritus, itching, is a symptom of an allergic reaction. Intravascular injection does not cause sedation in the client. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
During the assessment of a patient with fractures of the medial ulna and radius, the nurse finds all of these data. Which assessment findings should the nurse report to the healthcare provider immediately? 1. The patient reports pressure and pain. 2. The cast is in place and is dry and intact. 3. The skin is pink and warm to the touch. 4. The patient can move all the fingers and the thumb. The correct answer is 1. The patient reports pressure and pain. Rationale. Pressure and pain may be caused by increased compartment pressure and can indicate the serious complication of acute compartment syndrome. This situation is urgent. If it is not treated, cyanosis, tingling, numbness, paresis, and severe pain can occur. The other findings are normal and should be documented in the patient's chart.
The client with colon cancer has an abdominal perineal resection with a colostomy. Which of the following nursing interventions is most appropriate for this client in the post-operative period? 1. Maintain the client in a semi-Fowler's position. 2. Assist the client with warm sitz baths. 3. Administer 30 milliliters of milk of magnesia to stimulate peristalsis. 4. Remove the ostomy pouch as needed so the stoma can be assessed. The correct answer is 2. Assist the client with warm sitz baths. Appropriate nursing interventions after an abdominal perineal resection with a colostomy include assisting the client with warm sitz baths 3 to 4 times a day to clean the perineal incision. The client will be more comfortable assuming a side-lying position because of the perineal incision. It would be inappropriate to administer milk of magnesia to stimulate colostomy activity. Stool passage will begin as peristalsis returns. It is not necessary or desirable to change the ostomy pouch daily to assess the stoma. The ostomy pouch should be transparent to allow easy observation of the stoma and drainage. The nurse is reviewing the complete blood count for a patient who has been admitted for knee arthroscopy. Which value is most important to report to the healthcare provider before surgery? 1. Hematocrit of 33%. 2. Hemoglobin level of 10.9 grams per deciliter. 3. Platelet count of 426,000 cubic milliliters. 4. White blood cell count of 16,000 cubic milliliters. The correct answer is 4. White blood cell count of 16,000 cubic milliliters. Centers for Disease Control and Prevention guidelines for the prevention of surgical site infections indicate that surgery should be postponed when there is evidence of a pre-existing infection, such as an elevation in white blood cell count. The other values are slightly abnormal, but would not be likely to cause post-operative problems for knee arthroscopy. Which information should the nurse teach the client diagnosed with acute sinusitis? 1. Instruct the client to complete all the ordered antibiotics. 2. Teach the client how to irrigate the nasal passages. 3. Have the client demonstrate how to blow the nose. 4. Give the client samples of a narcotic analgesic for the headache. The correct answer is 1. Instruct the client to complete all the ordered antibiotics. The client should be taught to take all antibiotics as ordered. Discontinuing antibiotics prior to the full dose results in the development of antibiotic-resistant bacteria. Sinus infections are difficult to treat and may become chronic and will then require several weeks of therapy or possibly surgery to control. If the sinuses are irrigated, it is done under anesthesia by a healthcare provider. Blowing the nose will increase pressure in the sinus cavities and will cause the client increased pain. The nurse is not licensed to prescribe medications, so this is not in the nurse's scope of practice. Also, narcotic analgesic medications are controlled substances and require written documentation of being prescribed by the healthcare provider. Samples are not generally available. Note in this situation, an all is in the correct answer. There are very few cases in which absolute adjectives will describe the correct answer. You must be aware that general rules will not always apply. The nurse is teaching the client diagnosed with angina about sublingual nitroglycerin. Which statement indicates the client needs more medication teaching? 1. I will always carry my nitroglycerin in a dark-colored bottle. 2. If I have chest pain, I will put a tablet underneath my tongue. 3. If my pain is not relieved with one tablet, I will get medical help. 4. I should expect to get a headache after taking my nitroglycerin. The correct answer is 3. If my pain is not relieved with one tablet, I will get medical help. The client should put one tablet under the tongue every 5 minutes, and if the chest pain is not relieved after taking 3 tablets, the client should seek medical attention. This statement indicates the client needs more teaching about the medication. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client with vasospastic disorder, Raynaud's phenomenon, has coldness and numbness in the fingers. The nurse assesses the client for effects of vasoconstriction. Which of the following is an early sign of vasoconstriction? 1. Cyanosis. 2. Gangrene. 3. Pallor. 4. Rubor. The correct answer is 3. Initially, the vasoconstriction effect produces pallor or a whitish coloring, followed by cyanosis and finally rubor. Gangrene is the end result of complete arterial occlusion. The skin is blackened and without a blood supply.
A client with heart failure has bilateral +4 edema of the right ankle that extends up to the midcalf. The client is sitting in a chair with the legs in a dependent position. Which of the following goals is the priority? 1. Decrease venous congestion. 2. Maintain normal respirations. 3. Maintain body temperature. 4. Prevent injury to lower extremities. The correct answer is 1. Decrease venous congestion. Decreasing venous congestion in the extremities is a desired outcome for clients with heart failure. The nurse should elevate the client's legs above the level of the heart to achieve this goal. The client is not demonstrating difficulty breathing or being cold. The nurse should prevent injury to the swollen extremity. However, this is not the priority.
The client with depression has been consistent with taking 12.5 milligrams of paroxetine, Paxil, extended release daily. The nurse judges the client to be benefiting from this drug therapy when the client demonstrates which of the following behaviors? Select all that apply. 1. Takes 2-hour evening naps daily. 2. Completes homework assignments. 3. Decreases pacing. 4. Increases somatization. 5. Verbalizes feelings. The correct answers are 2. Completes homework assignments. 3. Decreases pacing. And 5. Verbalizes feelings. Rationale. Symptoms of depression include depressed mood, appetite disturbance, sleep disturbance, psychomotor disturbance, fatigue, feelings of worthlessness, excessive or inappropriate guilt, and decreased concentration. Paroxetine is a selective serotonin reuptake inhibitor antidepressant that also can be used to treat anxiety. Improved concentration, verbalization of feelings, and decreased agitation or pacing are signs of improvement. Taking 2-hour evening naps daily is still a sign of fatigue or lack of energy, and the increased use of somatization could be signs of continued symptoms of depression.
Which client should the nurse use caution with when applying mafenide acetate to a burned area? 1. A client with a creatinine level of 0.8 milligrams per deciliter. 2. A client diagnosed with chronic obstructive pulmonary disease. 3. A client with a pulse oximeter reading of 95%. 4. A client diagnosed with type 2 diabetes who is taking insulin. The correct answer is 2. A client diagnosed with chronic obstructive pulmonary disease. Mafenide acetate is a topical antimicrobial. Mafenide acetate impairs the renal mechanism involved in the buffering of the blood, thereby increasing the excretion of bicarbonate in the urine. When this occurs, the pulmonary system effects a compensatory hyperventilatory status to maintain normal acid-base balance. If this compensation cannot take place as a result of pulmonary disease, the client develops metabolic acidosis. Mafenide acetate affects the acid-base balance in the body and should not be administered to clients diagnosed with renal disease. A 0.8 milligrams per deciliter serum creatinine level is within normal range of 0.5 to 1.5 milligrams per deciliter. Therefore, the nurse would not need to use caution with this client. This client has adequate respiratory status. Therefore, the nurse would not need to use caution with this client. There is no reason a client diagnosed with diabetes could not be prescribed mafenide acetate. The client is admitted to the emergency department diagnosed with a partial and full thickness burn to the left leg. Which question is most important for the nurse to ask the client? 1. When was your last tetanus shot? 2. Can you tell me how this burn happened? 3. Will you need any help when you go home? 4. Have you taken any antibiotics in the last week? The correct answer is 1. When was your last tetanus shot? A tetanus toxoid is administered intramuscularly early in the acute phase of burn care to prevent Clostridium tetani infection. If the client has not had a tetanus shot within the last 10 years, or if the time is in doubt, a booster of tetanus toxoid should be administered.
Crackles heard on lung auscultation indicate which of the following? 1. Cyanosis. 2. Bronchospasm. 3. Airway narrowing. 4. Fluid-filled alveoli. The correct answer is 4. Fluid-filled alveoli. Rationale. Crackles are auscultated over fluid-filled alveoli. Crackles heard on lung auscultation do not have to be associated with cyanosis. Bronchospasm and airway narrowing generally are associated with wheezing sounds.
The nurse is preparing to administer topical benzocaine to a client with a 4th-degree episiotomy. Which interventions should the nurse implement? Rank in order of performance. 1. Position the client on the side with top leg up and forward. 2. Wash hands and don non-sterile examination gloves. 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 5. Apply the benzocaine to the perineal area. The correct order is 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 2. Wash hands and don non-sterile examination gloves. 1. Position the client on the side with top leg up and forward. And 5. Apply the benzocaine to the perineal area. The nurse must first determine if this is the right client receiving the right medication. The nurse should always check for allergies. With this medication, cane drugs are anesthetics, and if the client is allergic to lidocaine or novocaine, the client should not receive this medication. Once the nurse determines that this is the right client to receive the right medication and that the client has no allergies, then the nurse must wash his or her hands and use gloves to administer a medication to the perineal area. The position on the side with top leg up and forward allows maximum exposure to the area that should be medicated. After completing all the previous steps, the nurse can apply the medication.
A patient who underwent a right above the knee amputation 4 days ago also has a diagnosis of depression. Which prescription would the nurse clarify with the healthcare provider? 1. Give fluoxetine 40 milligrams once a day. 2. Administer acetaminophen with codeine 1 or 2 tablets every 4 hours as needed. 3. Assist a patient to the bedside chair every shift. 4. Reinforce the dressing to the right residual limb as needed. The correct answer is 1. Give fluoxetine 40 milligrams once a day. Rationale. Doses of fluoxetine, a drug used to treat depression, that are greater than 20 milligrams should be given in 2 divided doses, not once a day. The other 3 prescriptions are appropriate for a patient who underwent amputation 4 days earlier.
The nurse assesses the client's stoma during the initial post-operative period. Which of the following observations should be reported immediately to the physician? 1. The stoma is slightly edematous. 2. The stoma is dark red to purple. 3. The stoma oozes a small amount of blood. 4. The stoma does not expel stool. The correct answer is 2. The stoma is dark red to purple. A dark red to purple stoma indicates inadequate blood supply. Mild edema and slight oozing of blood are normal in the early post-operative period. The colostomy would typically not begin functioning until 2 to 4 days after surgery. The nurse is providing orientation for a new nurse who is preparing to administer packed red blood cells to a patient who had blood loss during surgery. Which action by the new nurse requires that the nurse intervene immediately? 1. Waiting 20 minutes after obtaining the PRBCs before starting the infusion. 2. Starting an IV line for the transfusion using a 22-gauge catheter. 3. priming the transfusion set using 5% dextrose in lactated Ringer's solution. 4. Telling the patient that the PRBCs may cause a serious transfusion reaction. The correct answer is 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. Normal saline, an isotonic solution, should be used when priming the IV line to avoid causing hemolysis of red blood cells. Ideally, blood products should be infused as soon as possible after they are obtained. However, a 20-minute delay would not be unsafe. Large-bore IV catheters are preferable for blood administration. If a smaller catheter must be used, normal saline may be used to dilute the RBCs. Although the new nurse should avoid increasing patient anxiety by indicating that a serious transfusion reaction may occur, this action is not as high a concern as using an inappropriate fluid for priming the IV tubing. The client has been diagnosed with chronic sinusitis. Which sign-symptom alerts the nurse to a potentially life-threatening complication? 1. Muscle weakness. 2. Purulent sputum. 3. Nuchal rigidity. 4. Intermittent loss of muscle control. The correct answer is 3. Nuchal rigidity. Nuchal rigidity is a sign-symptom of meningitis, which is a life-threatening potential complication of sinusitis resulting from the close proximity of the sinus cavities to the meninges. Intermittent loss of muscle control can be a symptom of multiple sclerosis, but it would not be a life-threatening complication of sinusitis. Muscle weakness is a sign-symptom of myalgia, but it is not a life-threatening complication of sinusitis. Purulent sputum would be a sign-symptom of a lung infection, but it is not a life-threatening complication of sinusitis. A basic knowledge of anatomy and physiology would help to answer this question. The sinuses lie in the head and surround the orbital cavity. Options 1 and 4 refer to muscle problems, so both could be ruled out as wrong. The nurse is preparing to administer a nitroglycerin transdermal patch to the client diagnosed with a myocardial infarction. Which intervention should the nurse implement? 1. Question applying the patch if the client's blood pressure is less than 110/70. 2. Use bare hands when applying the transdermal patch. 3. Date and time the transdermal patch prior to applying to client's skin. 4. Place the transdermal patch on the site where the old patch was removed. The correct answer is 3. Date and time the transdermal patch prior to applying to client's skin. The nurse should remove the old patch, wash the client's skin, note the date and time the new patch is applied, and apply it in a new area that is not hairy. The transdermal patch must be rotated so that skin irritation will not occur. Nitroglycerin, a coronary vasodilator, causes hypotension, and the nurse should question administering a transdermal patch if the client's blood pressure is less than 90/60, but not if it is less than 110/70.
During an initial assessment of a client diagnosed with vasospastic disorder, Raynaud's phenomenon, the nurse notes a sudden color change from pink to white in the fingers. The nurse should first assess 1. Appearance of cyanosis. 2. Radial pulse. 3. Oxygen saturation of the affected fingers. 4. Blood pressure. The correct answer is 2. Decreased perfusion from vasospasm induces color changes in the extremity. The degree of decreased perfusion should be assessed by taking the radial pulse. Color changes progressively to blue with cyanosis and then red when reperfusion occurs. The oxygen saturation requires adequate perfusion for accuracy. A blood pressure will cause further constriction and reduction of perfusion in the extremity.
The nurse is assessing an older Caucasian male who has a history of peripheral vascular disease. The nurse observes that the man's left great toe is black. The discoloration is probably a result of 1. Atrophy. 2. Contraction. 3. Gangrene. 4. Rubor. The correct answer is 3. Gangrene. The term gangrene refers to blackened, decomposing tissue that is devoid of circulation. Chronic ischemia and death of the tissue can lead to gangrene in the affected extremity. Injury, edema, and decreased circulation lead to infection, gangrene, and tissue death. Atrophy is the shrinking of tissue, and contraction is joint stiffening secondary to disuse. The term rubor denotes a reddish color of the skin.
A client diagnosed with major depression has sleep and appetite disturbances and a flat effect and is withdrawn. The client has been taking fluvoxamine Luvox, 50 milligrams twice daily for 5 days. Which client behavior is most important to report to the next shift? 1. Client's flat effect. 2. Clients interacting with a visitor. 3. Clients sleeping from 11 p.m. to 6 a.m. 4. Client spending the entire evening in her room. The correct answer is 3. Client sleeping from 11 p.m. to 6 a.m. Rationale. The most important behavior to report to the next shift is that the client was able to sleep from 11 p.m. to 6 a.m. This indicates that improvement in the symptoms of depression is occurring as a result of pharmacologic therapy. The nurse would expect to observe improvement in sleep, appetite, and psychomotor behavior first before improvement in cognitive symptoms. The client's flat effect is still a symptom of depression. The fact that the client had a visitor is not as important as changes in the client's behavior. Spending the evening in her room is a continuation of the client's withdrawn behavior and is important to report, but not as important as the improvement in sleep.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse initiates a visit from a member of the clergy for a patient. How is the nurse functioning when initiating this visit? 1. Interdependently. 2. Independently. 3. Dependently. 4. Collegially. The correct answer is 2. Independently. A nurse does not need a primary healthcare provider's order to make a referral to a member of the clergy. An interdependent intervention requires a primary healthcare provider's order associated with a parameter. When a nurse initiates a referral to a member of the clergy, the nurse is working independently. A nurse can make a referral to a member of the clergy. This action is within the scope of nursing practice. The nurse can make a referral to a member of the clergy without collaborating with another professional healthcare team member. Which organization is responsible for ensuring that nurses are minimally qualified to practice nursing? 1. State Boards of Nursing. 2. American Nurses Association. 3. Sigma Theta Tau International. 4. Constituent Leagues of the National League for Nursing. The correct answer is 1. State Boards of Nursing. The National Council of State Boards of Nursing is responsible for the NCLEX examinations. However, the licensing authority in the jurisdiction in which the graduate takes the examination verifies the acceptable score on the examination. When the nurse is assessing a patient with chronic kidney disease who is receiving epoetin alpha injections, which finding most indicates a need to talk with the healthcare provider before giving the medication. 1. Hemoglobin level is 8.9 grams per deciliter. 2. Blood pressure is 198/92. 3. The patient does not like subcutaneous injections. 4. The patient has a history of myocardial infarction. The correct answer is 2. Blood pressure is 198/92. Epoetin alpha can cause hypertension, and blood pressure should be controlled before administering the medication. Because patients with chronic kidney disease have chronic anemia, a hemoglobin level of 8.9 grams per deciliter is not unusual. Although the nurse could ask the HCP about IV administration of the medication, subcutaneous administration requires a lower dose of the medication and is preferred. Epoetin alpha can cause angina or myocardial infarction, but the risk is highest when hemoglobin levels are greater than 11 grams per deciliter. The nurse is planning the care of a client diagnosed with pneumonia and writes a problem of impaired gas exchange. Which is an expected outcome for this problem? 1. Performs chest physiotherapy 3 times a day. 2. Able to complete activities of daily living. 3. Ambulates in the hall several times during each shift. 4. Alert and oriented to person, place, time, and events. The correct answer is 4. Alert and oriented to person, place, time, and events. Impaired gas exchange results in hypoxia, the earliest sign symptom of which is a change in the level of consciousness. Clients do not perform chest physiotherapy. This is normally done by the respiratory therapist. Option 1 is a staff goal, not a client goal. Option 2 would be a goal for self-care deficit, but not for impaired gas exchange. Option 3 would be a goal for the problem of activity intolerance. You should match the answer option to the listed nursing problem. When writing goals for the client, it is important to remember they are written in terms of what is expected of the client. The client diagnosed with coronary artery disease is instructed to take 81 milligrams of aspirin. Which statement best describes the scientific rationale for prescribing this medication? 1. This medication will help thin the client's blood. 2. Daily aspirin will decrease the incidence of angina. 3. This medication will prevent platelet aggregation. 4. Baby aspirin will not cause gastric distress. The correct answer is 3. This medication will prevent platelet aggregation. When 81 milligrams of aspirin, a baby aspirin, is taken daily, it helps prevent platelet aggregation, which, in turn, helps the blood pass through the narrowed arteries more easily.
The nurse is administering packed red blood cells to a client. The nurse should first 1. Discontinue the IV catheter if a blood transfusion reaction occurs. 2. Administer the PRBCs through a percutaneously inserted central catheter line with a 20-gauge needle. 3. Flush PRBCs with 5% dextrose and 0.45% normal saline solution. 4. Stay with the client during the first 15 minutes of infusion. The correct answer is 4. The most likely time for a blood transfusion reaction to occur is during the first 15 minutes or first 50 milliliters of the infusion. If a blood transfusion reaction does occur, it is imperative to keep an established IV line so that medication can be administered to prevent or treat cardiovascular collapse in case of anaphylaxis. PRBC should be administered through a 19-gauge or larger needle. A peripherally inserted central catheter line is not recommended. In order to avoid a slow flow, RBCs will hemolyze in dextrose or lactated ringer solution and should be infused with only normal saline solution.
A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you will be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation.
The nurse is caring for a client who recently experienced a myocardial infarction and has been started on clopidogrel, Plavix. The nurse should develop a teaching plan that includes which of the following points? Select all that apply. 1. The client should report unexpected bleeding or bleeding that lasts a long time. 2. The client should take Plavix with food. 3. The client may bruise more easily and may experience bleeding gums. 4. Plavix works by preventing platelets from sticking together and forming a clot. 5. The client should drink a glass of water after taking Plavix. The correct answers are 1. The client should report unexpected bleeding or bleeding that lasts a long time. 3. The client may bruise more easily and may experience bleeding gums. And 4, Plavix works by preventing platelets from sticking together and forming a clot. Rationale. Plavix is generally well absorbed and may be taken with or without food. It should be taken at the same time every day, and while food may help prevent potential GI upset, food has no effect on absorption of the drug. Bleeding is the most common adverse effect of Plavix. The client must understand the importance of reporting any unexpected, prolonged, or excessive bleeding, including blood in urine or stool. Increased bruising and bleeding gums are possible side effects of Plavix. The client should be aware of this possibility. Plavix is an antiplatelet agent used to prevent clot formation in clients that have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome. It is not necessary to drink a glass of water after taking Plavix.
At a preconception visit, the nurse instructs the client on the importance of folic acid in the prevention of serious birth defects. Which statement to the nurse indicates the client needs more teaching? 1. I will increase my intake of spinach, orange juice, and almonds. 2. I will increase my intake of milk, yogurt, and fish. 3. I will take my prenatal vitamin with folic acid daily. 4. I will avoid overcooking my food to prevent vitamin loss. The correct answer is 2. I will increase my intake of milk, yogurt, and fish. Milk, yogurt, and fish are not a source of dietary folic acid. Green leafy vegetables, citrus foods, and nuts such as peanuts and almonds are rich in folic acid. A prenatal vitamin with 400 micrograms of folic acid is recommended for a client preparing for pregnancy or a client who is pregnant or lactating. Folic acid can prevent neural tube defects, cardiac defects, and cleft lip or palate. Folic acid can be lost when overcooking foods.
The emergency department nurse receives a call about a patient with a traumatic finger amputation. What instructions will the nurse provide to the patient's wife? Select all that apply. 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 3. Place the bag directly on ice. 4. Elevate the affected extremity above the patient's heart. 5. Examine the amputation site and apply direct pressure with layers of dry gauze. 6. After performing these steps, call 911 and check the patient for breathing. The correct answers are 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 4. Elevate the affected extremity above the patient's heart. And 5. Examine the amputation site and apply direct pressure with layers of dry gauze. Rationale. For a person who has a traumatic amputation in the community, first call 911 and then assess the patient for airway or breathing problems. Examine the amputation site and apply direct pressure with layers of dry gauze or cloth. Elevate the extremity above the patient's heart to decrease the bleeding. Do not remove the dressing to prevent dislodging the clot. Wrap the completely severed finger in dry sterile gauze or a clean cloth. Put the finger in a watertight, sealed plastic bag. Place the bag in ice water, never directly on ice, with 1 part ice and 3 parts water. Avoid contact between the finger and the water to prevent tissue damage. Do not remove any semi-detached parts of the digit. Be sure that the part goes with the patient to the hospital.
The client with an abdominal hysterectomy is being prepared for discharge in the morning. The client has a mentally retarded adult son whom she cares for at home. The nurse should discuss with the physician the need for referral to which of the following departments? 1. Home health care. 2. Social work. 3. Pastoral care. 4. Volunteer services. The correct answer is 2. Social work. The social worker will be able to coordinate respite care for the son and other community resources for this family. Home health care would provide care for the client herself, but respite care for the son is the priority need for this family. Pastoral care provides spiritual care. The volunteer department would not be responsible for coordination of care at the client's home. Phenylephrine, an adrenergic agonist, has been prescribed as a topical application for a patient who had intraocular surgery. Although systemic toxicity is unlikely, which adverse physiologic response is the concern? 1. cardiovascular response, such as hypertension or ventricular dysrhythmias. 2. Renal response, such as urinary retention or urinary incontinence. 3. Respiratory response, such as bronchospasm or mucus plugs. 4. Musculoskeletal response, such as bone pain or joint stiffness. The correct answer is 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. Topical phenylephrine usually does not cause systemic reactions because the amount of absorption is very small. Cardiac responses are the concern. Other possible reactions may include sweating, tremors, agitation, or confusion. The HCP prescribed morphine 2 to 5 milligrams intramuscular every 2 hours for the client diagnosed with full thickness, burns to the chest and abdominal area. The client reports pain of 10 on a pain scale from 1 through 10. Which intervention should the nurse implement? 1. Administer 5 milligrams of morphine IM to the client immediately. 2. Contact the HCP to request an increase in the medication. 3. Request a patient-controlled analgesia pump for the client. 4. Assess the client for complications and then administer the medication. The correct answer is 3. Request a patient-controlled analgesia pump for the client. The client should have IV pain medication until hemodynamic stability and unimpaired tissue perfusion return. The PCA pump provides an IV route, and the client can control the amount of medication administered with the PCA, ensuring safe limits of pain medication. The client should receive IV medication, not IM medication. Therefore, the nurse should not administer this medication after assessing the client. The nurse should be a client advocate and notify the HCP for a change in the route of the morphine. For which primary reason is a nurse expert called to testify in a lawsuit regarding professional nursing malpractice? 1. To strengthen the defense. 2. To support the prosecution. 3. To present standards of nursing care as they apply to the facts in the case. 4. To make judgments associated with laws governing the practice of nursing. The correct answer is 3. To present standards of nursing care as they apply to the facts in the case. The American Nurses Association Standards of Clinical Nursing Practice are authoritative statements by which the National Organization for Nursing describes the responsibilities for which nurses are accountable. An expert nurse is capable of explaining these standards as they apply to the situation under litigation. These professional standards are criteria that help a judge or jury determine if a nurse committed malpractice or negligence. When caring for a terminally ill patient, a family member says, "I need your help to hasten my mother's so that she is no longer suffering." What should the nurse do based on the position of the American Nurses Association in relation to assisted? 1. Not participate in active euthanasia. 2. Participate based on personal values and beliefs. 3. Participate when the patient is experiencing severe pain. 4. Not participate unless 2 primary healthcare providers are consulted and the patient has had counseling. The correct answer is 1. Not participate in active euthanasia. Nursing actions must comply with the law, and the law states that euthanasia is legally wrong. Euthanasia can lead to criminal charges of homicide or civil lawsuits for providing an unacceptable standard of care. A nurse's beliefs, values, or moral convictions should not be imposed on patients. Compassion and good intentions are not an acceptable basis for actions beyond the scope of nursing practice. Nurses, as well as other healthcare providers, cannot legally be involved with euthanasia. In some states in the United States, a primary healthcare provider can prescribe a medication that can be taken by a patient to cause death. The American Nurses Association, according to its Code for Nurses with Interpretive Statement, indicates that nurses should not participate in active euthanasia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse in a long-term care facility is planning the care for a client with a percutaneous endoscopic gastrostomy feeding tube. Which intervention should the nurse include in the plan of care? 1. Inspect the insertion line at the nares prior to instilling formula. 2. Elevate the head of the bed after feeding the client. 3. Place the client in the Sims position following each feeding. 4. Change the dressing on the feeding tube every 3 days. The correct answer is 2. Elevate the head of the bed after feeding the client. Elevating the head of the bed uses gravity to keep the formula in the gastric cavity and help prevent it from refluxing into the esophagus, which predisposes the client to aspiration. A gastrostomy tube is placed directly into the stomach through the abdominal wall. The nares is the opening of the nostril. The Sims position is the left lateral side-lying flat position. This position is used for administering enemas and can be used to prevent aspiration in clients sedated by anesthesia. The sedated client would not have a full stomach. Dressings on PEG tubes should be changed at least daily. If there is no dressing, the insertion site is still assessed daily. The client with coronary artery disease is prescribed cholestyramine. Which intervention should the nurse implement when administering the medication? 1. Administer the medication with fruit juice. 2. Instruct the client to decrease fiber when taking the medication. 3. Monitor the cholesterol level before giving medication. 4. Assess the client for upper abdominal discomfort. The correct answer is 1. Administer the medication with fruit juice. Cholestyramine is a bile acid sequestrant. This medication should be administered with water, fruit juice, soup, or pulpy fruit such as pineapple to reduce the risk of esophageal irritation.
The nurse should instruct a young female adult with sickle cell anemia to do which of the following? Select all that apply. 1. Drink plenty of fluids when outside in hot weather. 2. Avoid being in high altitudes. 3. Be aware that since she is homozygous for hemoglobin S, she carries the sickle cell trait. 4. Know that pregnancy with sickle cell disease increases the risk of a crisis. 5. Avoid flying on commercial airlines. The correct answers are 1, 2, and 4. The nurse should teach the client to drink plenty of fluids to avoid becoming dehydrated. The client should avoid being in high altitudes, such as mountains above 5,000 feet, where there is less oxygen in the air, which may precipitate a sickle cell crisis. The nurse should alert young women with sickle cell anemia that pregnancy increases the risk of a crisis. People who are homozygous for hemoglobin S have sickle cell anemia. The heterozygous form is the sickle cell carrier trait. A client with sickle cell anemia may fly on commercial airlines. The airplane is pressurized and has an adequate oxygen level.
A client who is in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate post-operative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. Maintain a patent airway. The priority of care in the immediate post-operative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important.
Which client is at greatest risk for coronary artery disease? 1. A 32-year-old female with mitral valve prolapse who quit smoking 10 years ago. 2. A 43-year-old male with a family history of CAD and cholesterol level of 158. 3. A 56-year-old male with an HDL of 60 who takes atorvastatin. 4. A 65-year-old female who is obese with an LDL of 188. The correct answer is for a 65-year-old female who is obese with an LDL of 188. Rationale: the woman who is 65 years old, overweight, and has an elevated LDL is at greatest risk. The combination of postmenopausal obesity and high LDL places this client at greatest risk.
The pregnant client is prescribed metoclopramide to treat hyperemesis gravidarum. Which information should the nurse discuss with the client? Select all that apply. 1. Chew the tablet thoroughly before swallowing. 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. 4. Muscle spasms are a common side effect. 5. The medication can cause drowsiness that will make driving unsafe. The correct answers are 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. And 5. The medication can cause drowsiness that will make driving unsafe. The medication should be taken on an empty stomach at least 30 minutes before eating. Alcohol can increase central nervous system depressive symptoms of the medication and should be avoided. Metoclopramide can cause drowsiness. The client should avoid driving until the response to medication is known. The client should swallow the medication. The client should not crush, chew, or suck on the medication. Muscle spasms and rigidity are extrapyramidal side effects and should be reported to the HCP.
When receiving discharge instructions, a patient with osteoporosis makes all of these statements. Which statement indicates to the nurse that the patient needs additional teaching? 1. I take my ibuprofen every morning as soon as I get up. 2. My daughter removed all of the throw rugs in my home. 3. My husband helps me every afternoon with range of motion exercises. 4. I rest in my reclining chair every day for at least an hour. The correct answer is 1. I take my ibuprofen every morning as soon as I get up. Rationale. Ibuprofen can cause abdominal discomfort or pain and ulceration of the gastrointestinal tract. In such cases, it should be taken with meals or milk. Removal of throw rugs helps prevent falls. Range of motion exercises and rest are important strategies for coping with osteoporosis.
When preparing discharge instructions for a client after an abdominal hysterectomy, the nurse should first 1. Have the client watch an educational video. 2. Assess the client's available social supports. 3. Call the social worker to evaluate the client. 4. Read the discharge instructions to the client. The correct answer is 2. Assess the client's available social supports. Assessment is the first step in planning client education. Assessing social support resources is a key aspect of discharge planning that begins when the client is admitted to the hospital. It is imperative to know what assistance and support the client has at home. Assessment includes obtaining data about any family or home responsibilities the client is concerned with during the recovery period. It is within the scope of nursing practice to provide discharge instructions. A social worker is not needed at this time. The nurse should assess the client's needs before determining whether using a video or reading instructions to the client is appropriate. An older patient had ranibizumab injected into his eye for treatment of wet age-related macular degeneration several days ago. He is now experiencing redness, light sensitivity, and pain. Which advice would the nurse give to the patient? 1. These are common side effects that should pass after a few more days. 2. Contact the healthcare provider immediately for possible eye infection. 3. Rest eyes as much as possible and wear sunglasses if lights are too bright. 4. Inform the HCP before the next treatment so that the dosage can be adjusted. The correct answer is 2. Contact the healthcare provider immediately for possible eye infection. Ranibizumab is an angiogenesis inhibitor that is directly injected into the vitreous humor of the eye. The purpose of the medication injection is to inhibit the growth of new blood vessels in patients who have neovascular age-related macular degeneration. The biggest concern about adverse effects of the treatment is endophthalmitis. This can be caused by bacteria, virus, or fungus. Redness, light sensitivity, or pain are signs of possible endophthalmitis that should be immediately reported to the provider. The client is prescribed silver sulfadiazine for a partial thickness burn to the back. Which information should the nurse discuss concerning this medication? 1. Encourage the client to drink 3,000 milliliters of water. 2. Discuss the need to eat foods high in protein. 3. Teach the client how to test the urine for ketones. 4. Instruct the client to change the dressing twice a day. The correct answer is 1. Encourage the client to drink 3,000 milliliter of water. Silver sulfadiazine is a sulfonamide antibacterial agent. The client should drink large amounts of fluids to prevent sulfa crystals from forming in the urine. The client should eat foods high in protein for healing purposes, but this does not specifically concern this medication. Ketones are a byproduct of fat breakdown and would not be specific for teaching about silver sulfadiazine. The client should change the dressing twice a day, but this is not part of teaching about the medication silver sulfadiazine. The parents of a 5-week-old have just been told that their child has cystic fibrosis. The mother had a sister who died of CF when she was 19 years of age. The parents are sad and ask the nurse about their child's projected life expectancy. What is the nurse's best response? 1. The life expectancy for CF patients has improved significantly in recent years. 2. Your child might not follow the same course that the mother's sister did. 3. The healthcare provider will come to speak to you about treatment options. 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The correct answer is 4. The nurse answers their questions briefly, listens to their concerns, and is available later after they've processed the information. The nurse's best intervention is to listen as the parents express their concerns and fears. The nurse's answers should be brief, knowing that the parents are not able to process information right now. The nurse should be available later if the parents have any other concerns or questions, or if they just need someone with whom to talk. A 2-year-old has just been diagnosed with cystic fibrosis. The parents ask the nurse what early respiratory symptoms they should expect to see in their child. Which is the nurse's best response? 1. You can expect your child to develop a barrel-shaped chest. 2. You can expect your child to develop a chronic productive cough. 3. You can expect your child to develop bronchiectasis. 4. You can expect your child to develop wheezing respirations. The correct answer is 4. You can expect your child to develop wheezing respirations. Wheezing respirations and a dry, non-productive cough are common early symptoms in CF. Answer 2 can be eliminated because of the word chronic. Chronic implies that the disease process is advanced rather than in the initial stages. Answers 1 and 3 can be eliminated if you know of the signs and symptoms of advanced lung disease.
Which of the following comments indicates that a client understands the nurse's teaching about sertraline? 1. Zoloft will probably cause me to gain weight. 2. This medicine can cause decreased libido. 3. Dry mouth is a permanent side effect of Zoloft. 4. I can take my medicine with St. John's wort. The correct answer is 2. This medicine can cause decreased libido. Rationale. Sertraline, like other selective serotonin reuptake inhibitors, SSRIs, can cause decreased libido. SSRIs do not typically cause weight gain but may cause loss of appetite and weight loss. Dry mouth is a possible side effect, but it is temporary. The client should be told to take sips of water, suck on ice chips, or use sugarless gum or candy. St. John's wort should not be taken with SSRIs because a severe reaction could occur.
The client in labor has an epidural catheter in place for anesthesia. Which intervention is most important for the labor and delivery nurse? 1. Assist the client with breathing exercises during contractions. 2. Ensure the client's legs are correctly positioned in the stirrups. 3. Have the significant other scrub for the delivery of the baby. 4. Titrate the epidural medication to ensure analgesic effect. The correct answer is 2. Ensure the client's legs are correctly positioned in the stirrups. Because the legs are numb as a result of the epidural, the nurse must ensure the legs are in the stirrups correctly so that the client will not experience neurovascular compromise or any type of injury to the legs when they are in the stirrups. Breathing exercises are important, but the protection of the client's lower extremities while under anesthesia should be a priority for the nurse. Preparing the significant other for the delivery is important, but it is not a priority over the safety of the mother's lower extremities. The anesthesiologist or nurse anesthetist would be responsible for administering the anesthesia during the delivery.
The nurse is caring for a postoperative patient with a hip replacement. Which patient care actions can be delegated to the experienced assistive personnel? Select all that apply. 1. Inspect heels and other bony prominences every 8 hours. 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. 4. Assess the patient's calf regions for redness and swelling. 5. Check vital signs and oxygen saturation via pulse oximetry. 6. Assess for pain and administer pain medication. The correct answers are 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. And 5. Check vital signs and oxygen saturation via pulse oximetry. Rationale. The AP scope of practice includes repositioning patients and checking vital signs, and an experienced AP would know how to check pulse oximetry and elevate the patient's heels off the bed. Assessing and inspecting patients is more appropriate to the educational level of the professional nurse.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. While changing the client's colostomy bag and dressing, the nurse assesses that the client is ready to participate in self-care by noting which of the following. 1. The client asks what time the doctor will visit that day. 2. The client asks about the supplies used during the dressing change. 3. The client talks about the news on the television. 4. The client is upset about the way the night nurse changed the dressing. The correct answer is 2. The client asks about the supplies used during the dressing change. A client who displays interest in the procedure and asks about supplies used for dressings may be ready to participate in self-care. Inquiring about the physician's visit, discussing news events, and discussing a dressing change are behaviors that avoid the subject of the colostomy. A 32-year-old patient with sickle cell anemia is admitted to the hospital during a sickle cell crisis. Blood pressure is 104/62, oxygen saturation is 85%, and the patient reports pain at a level 8. Which action prescribed by the healthcare provider will the nurse implement first? 1. Administer morphine sulfate 4 to 8 milligrams IV. 2. Give oxygen at 4 liters per minute via nasal cannula. 3. Start an infusion of normal saline at 200 ml per hour. 4. Apply warm packs to painful joints. The correct answer is 2. Give oxygen at 4 liters per minute via nasal cannula. National guidelines for sickle cell crisis indicate that oxygen should be administered if the oxygen saturation is less than 95%. Hypoxia and deoxygenation of the blood cells are the most common cause of sickling, so administration of oxygen is the priority intervention here. Pain control and hydration are also important interventions for this patient and should be accomplished rapidly. The client diagnosed with tonsillitis is scheduled to have surgery in the morning. Which assessment data should the nurse notify the healthcare provider about prior to surgery? 1. The client has a hemoglobin of 12.2 grams per deciliter and hematocrit of 36.5%. 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. 3. There are 1 to 2 white blood cells in the urinalysis. 4. The client's current international normalized ratio is 1.0. The correct answer is 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. A low-grade temperature and a cough could indicate the presence of an infection, in which case the healthcare provider would not want to subject the client to anesthesia and the possibility of further complications. The surgery would be postponed. The hemoglobin and hematocrit given are within normal range. This would not warrant notifying the healthcare provider. 1 to 2 WBCs in a urinalysis is not uncommon because of the normal flora in the bladder. The INR indicates that the client's bleeding time is within normal range. In this question, all the answer options contain normal data except for one. the nurse would not call the healthcare provider to notify him or her of normal values. The client is reporting severe chest pain radiating down the left arm and is nauseated and diaphoretic. The HCP suspects the client is having an MI and has ordered morphine sulfate for the pain. Which interventions should the nurse implement? Select all that apply. 1. Instruct the client not to get out of the bed without notifying the nurse. 2. Administer the morphine sulfate intramuscularly in the ventral gluteal muscle. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. 4. Administer the morphine sulfate slowly over 5 minutes. 5. Question the order because morphine sulfate should not be administered to a client with an MI. The correct answers are 1. Instruct the client not to get out of the bed without notifying the nurse. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. And 4. Administer the morphine sulfate slowly over 5 minutes. The client should not get out of the bed without assistance due to the drowsiness the client will experience after receiving morphine sulfate, a narcotic analgesic. Also, the client is having chest pain and should not get out of bed without assistance. Morphine sulfate, a narcotic analgesic, is the drug of choice for chest pain, and it is administered intravenously so that it acts as soon as possible, within 10 to 15 minutes. IVP medications should be diluted to help decrease the pain when it is administered and to prevent irritation to the vein. Morphine sulfate may be administered intravenously when a rapid onset of action is desired. The dose is usually in the range of 2.5 to 15 milligrams, given slowly over 4 to 5 minutes.
The nurse should instruct a client who has been diagnosed with vasospastic disorder, Raynaud's phenomenon, to 1. Immerse the hands in cold water during an episode. 2. Wear light garments when the temperature gets below 50 degrees Fahrenheit. 3. Wear gloves when handling ice or frozen foods. 4. Live in a cold climate. The correct answer is 3. Extreme changes in temperature can precipitate a vasospastic episode and should be avoided by clients with vasospastic disorder, Raynaud's disease. The client should be encouraged to wear gloves when handling frozen foods or ice. The client should immerse the involved extremity in warm water during an episode to promote vasodilation and relaxation of the small arteries that are in spasm. The client can help prevent vasospasm brought on by temperature changes by wearing warm clothes. Living in a cold climate will exacerbate the symptoms.
A client has peripheral vascular disease of the lower extremities. The client tells the nurse, "I've really tried to manage my condition well." Which of the following routines should the nurse evaluate as having been appropriate for this client? 1. Resting with the legs elevated above the level of the heart. 2. Walking slowly but steadily for 30 minutes twice a day. 3. Minimizing activity. 4. Wearing anti-embolism stockings at all times when out of bed. The correct answer is 2. Walking slowly but steadily for 30 minutes twice a day. Slow, steady walking is a recommended activity for clients with peripheral vascular disease because it stimulates the development of collateral circulation. The client with PVD should not remain inactive. Elevating the legs above the heart or wearing anti-embolism stockings is a strategy for alleviating venous congestion and may worsen peripheral arterial disease.
A client with major depressive disorder has independently showered, dressed, and washed her hair for the first time since her admission to the inpatient unit 4 days ago. In an interaction with the nurse, she still stresses her faults. She states, "I'm just no good. I can't do anything right." The nurse's best response would be 1. You look very nice today. 2. You were able to shower, wash your hair, and dress today. 3. I'll get out the craft project that you wanted to complete. 4. What is your goal for today? The correct answer is 2. You were able to shower, wash your hair, and dress today. Rationale. An objective reflection by the nurse based on actual behavior is the best affirmation for the client to help boost self-esteem. Depressed persons tend to reject positive opinions from others. Picking a project for such a client is also likely to bring a negative response and/or foster dependence. Antipsychotics are sometimes prescribed for clients with bipolar disorder and would not pose a special concern.
A patient is asked to participate in a medical research study. Which document should the nurse explain to the patient because it protects the patient's rights? 1. Code of Ethics. 2. Informed Consent. 3. Nurse Practice Act. 4. Constitution of the United States. The correct answer is 2. Informed Consent. Informed consent is an agreement by a person to accept a course of treatment or a procedure after receiving complete information necessary to make a knowledgeable decision. Nurse Practice Acts define the scope of nursing practice. They are unrelated to participation in research studies. The parent of a child with cystic fibrosis asks the nurse what will be done to relieve the child's constipation. Which is the nurse's best response? 1. Your child likely has an obstruction and will require surgery. 2. Your child will likely be given IV fluids. 3. Your child will likely be given Miralax. 4. Your child will be placed on a clear liquid diet. The correct answer is 3. Your child will likely be given Miralax. CF clients with constipation commonly receive a stool softener or an osmotic solution such as Miralax orally to relieve their constipation. Answers 1 and 2 can be eliminated because surgery and IV fluids are not indicated for constipation. The parent of a child with cystic fibrosis is excited about the possibility of the child receiving a double lung transplant. What should the parent understand? 1. The transplant will cure the child of CF and allow the child to lead a long and healthy life. 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. 3. The transplant will help to reverse the multisystem damage that has been caused by CF. 4. The transplant will be the child's only chance at surviving long enough to graduate from college. The correct answer is 2. The transplant will not cure the child of CF, but will allow the child to have a longer life. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. Which data indicates to the nurse that simvastatin is effective? 1. The client's blood pressure is 132/80. 2. The client's cholesterol level is 180 milligrams per deciliter. 3. The client's LDL cholesterol level is 180 milligrams per deciliter. 4. The client's HDL cholesterol level is 35 milligrams per deciliter. The correct answer is 2. The client's cholesterol level is 180 milligrams per deciliter. Simvastatin is an HMG-CoA reductase inhibitor, or a statin that lowers cholesterol levels. A cholesterol level less than 200 milligrams per deciliter is desirable and indicates the medication is effective.
A client is having a blood transfusion reaction. The nurse must do the following in what order priority from first to last? 1. Notify the attending physician and blood bank. 2. Complete the appropriate transfusion reaction forms. 3. Stop the transfusion. 4. Keep the IV open with normal saline infusion. The correct order is 3, 4, 1, and 2. When the client is having a blood transfusion reaction, the nurse should first stop the transfusion and then keep the IV open with normal saline infusion. Next, the nurse should notify the physician and blood bank, then complete the required forms regarding the transfusion reaction.
A client who has had the jaws wired begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. Suction the client's airway as needed. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, but these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort, or in case of respiratory or cardiac arrest.
The client has been managing angina episodes with nitroglycerin. Which of the following indicate the drug is effective? 1. Decreased chest pain. 2. Increased blood pressure. 3. Decreased blood pressure. 4. Decreased heart rate. The correct answer is 1. Decreased chest pain. Rationale. Nitroglycerin acts to decrease myocardial oxygen consumption. Vasodilation makes it easier for the heart to eject blood, resulting in decreased oxygen needs. Decreased oxygen demand reduces pain caused by heart muscle not receiving sufficient oxygen. While blood pressure may decrease ever so slightly due to the vasodilation effects of nitroglycerin, it is only secondary and not related to the angina the patient is experiencing. Increased blood pressure would mean the heart would work harder, increasing oxygen demand and thus angina. Decreased heart rate is not an effect of nitroglycerin.
The client who is 32 weeks pregnant and in preterm labor is prescribed terbutaline. Which data warrants intervention by the nurse? 1. The client's respiratory rate is 34 breaths per minute. 2. The fetal heart rate is 150 beats per minute. 3. The client's apical heart rate is 104 beats per minute. 4. The client reports no contractions. The correct answer is 1. The client's respiratory rate is 34 breaths per minute. Terbutaline, a beta-adrenergic agonist, causes bronchodilation, and if the client's respiratory rate is abnormally high, or if there is a change in quality of lung sounds such as wheezing, rales, or coughing, the HCP should be notified. The normal fetal heart rate is 110 to 160 beats per minute. Therefore, a fetal heart rate of 150 beats per minute is within normal limits and would not warrant intervention by the nurse. The client's apical heart rate is just above normal and would not warrant intervention by the nurse. Terbutaline is administered to prevent contractions. Therefore, the medication is effective. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
After the nurse receives the change of shift report, which patient should be assessed first? 1. A 42-year-old patient with carpal tunnel syndrome who reports pain. 2. A 64-year-old patient with osteoporosis awaiting discharge. 3. A 28-year-old patient with a fracture who reports that the cast is tight. 4. A 56-year-old patient with a left leg amputation who reports phantom pain. The correct answer is 3. A 28-year-old patient with a fracture who reports that the cast is tight. Rationale. The patient with a tight cast is at risk for circulation impairment and peripheral nerve damage. Although all of the other patient's concerns are important, and the nurse will want to see them as soon as possible, none of their complaints is urgent. The patient with the tight cast may have risk for injury to a limb, which is more urgent.
Which of the following guidelines reflects the current American and Canadian Cancer Society's recommendations for screening for colon cancer in individuals who are not at high risk? 1. Annual digital rectal examination should begin at age 40. 2. Annual fecal testing for occult blood should begin at age 50. 3. Individuals should obtain a baseline barium enema at age 40. 4. Individuals should obtain a baseline colonoscopy at age 45. The correct answer is 2. Annual fecal testing for occult blood should begin at age 50. Annual fecal testing for occult blood should begin at age 50. Annual digital rectal examinations are recommended in men beginning at age 50 to screen for prostate cancer. Baseline barium enemas or colonoscopies are recommended at age 50. Baseline barium enemas and colonoscopies are not performed on individuals in their 40s unless they experience signs or symptoms that indicate the need for such diagnostic testing or are considered to be at high risk. The nurse is preparing to have a patient who has acute leukemia, sign the permit for a bone marrow aspiration. The patient states that the oncologist has explained the procedure and the complications, and she has no further questions. What assessment is most important for the nurse to complete before the procedure is carried out? 1. Review the patient's do not resuscitate status. 2. Review the platelet count. 3. Review the leukocyte count. 4. Ask when the patient ate last. The correct answer is 2. Review the platelet count. The most important assessment to carry out before the procedure is to review the platelet count to ensure that the platelets are within normal limits. A complication of a bone marrow aspiration is bleeding, and platelets are necessary for normal clotting to take place. The nurse should also review the prothrombin time, partial thromboplastin time, and international normalized ratio for the same reason. A patient's DNR status should be reviewed in case of an emergency on all ill patients as a general rule. The leukocyte count in leukemia is expected to be altered and is not important when considering the bleeding complication. Usually, it is not necessary for a patient to be NPO before the procedure. The male client diagnosed with a stage 4 pressure ulcer on the coccyx area is being treated with an autolytic medication for debridement and an occlusive dressing. The wife of the client asks the nurse, "Why isn't someone doing something about that foul odor my husband has?" Which statement is the nurse's best response? 1. I will contact your husband's doctor when he makes rounds. 2. The odor is secondary to an infection, and he is taking antibiotics. 3. The odor is an expected reaction to the pressure dressing. 4. I am sorry the odor bothers you. We will bathe your husband. The correct answer is 3. The odor is an expected reaction to the pressure dressing. Option 3 is an expected reaction to the pressure dressing. The foul odor is produced by the breakdown of cellular debris and does not indicate that the wound is infected. In option 1, there is no reason to contact the HCP because this is an expected reaction to the pressure dressing. In option 2, the client may have an infection and is taking antibiotics, but this is not causing the foul odor. In option 4, bathing the husband will not help the odor. Therefore, this response is not appropriate. A school-aged child has been diagnosed with nasopharyngitis. The parent is concerned because the child has had little or no appetite for the last 24 hours. Which is the nurse's best response? 1. Do not be concerned. It is common for children to have a decreased appetite during a respiratory illness. 2. Be sure your child is taking an adequate amount of fluids. The appetite should return soon. 3. Try offering the child some favorite foods. Maybe that will improve the appetite. 4. You need to force your child to eat whatever you can. Adequate nutrition is essential. The correct answer is 2. Be sure your child is taking an adequate amount of fluids. The appetite should return soon. It is common for children to have a decreased appetite when they have a respiratory illness. The nurse is appropriately instructing the parent that the child will be fine by taking in an adequate amount of fluid, which will keep the child hydrated. Answer 4 can be eliminated because one should not force the child to eat. If the word encourage had been used, answer 4 would have been a better choice, although still not the best answer. Answer 1 can be eliminated because the nurse did not inform the parent of the importance of maintaining adequate fluid intake.
A 6-month-old on the pediatric floor has a respiratory rate of 68, mild intercostal retractions, and oxygen saturation of 89%. The infant has not been feeding well for the last 24 hours and is restless. Using the SBAR Situation Background Assessment Recommendation technique for communication, the nurse calls the primary healthcare provider with the recommendation for 1. Starting oxygen. 2. Providing sedation. 3. Transferring to PICU. 4. Prescribing a chest CT scan. The correct answer is 1. The infant is experiencing signs and symptoms of respiratory distress, indicating the need for oxygen therapy. Sedation will not improve the infant's respiratory distress and would likely cause further respiratory depression. If the infant's respiratory status continues to decline, she may need to be transferred to the PICU. Oxygen should be the priority as it may improve the infant's respiratory status. A chest CT is not indicated. However, a chest X-ray will be another appropriate recommendation for this infant. A 12-year-old with cystic fibrosis is being treated in the hospital for pneumonia. The primary care provider is calling in a telephone prescription for ampicillin. The nurse should do which of the following? Select all that apply. 1. Ask the unit clerk to listen on the speakerphone with the nurse and write down the prescription. 2. Ask the primary care provider to come to the hospital and write the prescription on the chart. 3. Repeat the prescription to the primary care provider. 4. Ask the primary care provider to confirm that the prescription is correct as understood by the nurse. 5. Ask the nursing supervisor to co-sign the telephone prescription as transcribed by the nurse. The correct answers are 3 and 4. To ensure client safety in obtaining telephone prescriptions, the prescription must be received by a licensed nurse. The nurse should write the prescription, read the prescription back to the primary care provider, and receive confirmation from the primary care provider that the prescription is correct. It is not necessary to ask the unit clerk to listen to prescription, to require the primary care provider to come to the hospital to write the prescription on the chart, or to have the nursing supervisor co-sign the telephone prescription.
A nurse is informed that a credentialing team has arrived and is in the process of assessing the quality of care delivered at the hospital. Which organization is associated with the credentialing of hospitals? 1. The Joint Commission. 2. National League for Nursing. 3. American Nurses Association. 4. National Council Licensure Examination. The correct answer is 1. The Joint Commission. The Joint Commission evaluates healthcare organizations' compliance with standards stipulated by the Joint Commission. Accreditation indicates that the organization has the capabilities to provide quality care. In addition, federal and state regulatory agencies and insurance companies require accreditation by the Joint Commission. The National League for Nursing fosters the development and improvement of nursing education and nursing service. The American Nurses Association is the national professional organization for nursing in the United States. Its purposes are to promote high standards of nursing practice and to support the educational and professional advancement of nurses.
The nurse is mentoring a student nurse who is caring for a patient with carpal tunnel syndrome of the right hand with a neurovascular check ordered every 2 hours, for which action by the student nurse must the nurse intervene. 1. Student nurse checks the patient's radial pulse every 2 hours. 2. Student nurse checks for sensation in the patient's right hand. 3. Student nurse assesses color, temperature, and pain in right wrist and hand. 4. Student nurse instructs the patient to avoid movement because of the pain. The correct answer is 4. Student nurse instructs the patient to avoid movement because of the pain. Rationale. Performing complete neurovascular assessment includes palpation of pulses in the extremities below the level of injury and assessment of sensation, movement, color, temperature, and pain in the injured part. If pulses are not palpable, use of a Doppler helps find pulses in the extremities. After surgery, the patient should be given pain medication and encouraged to move the fingers frequently. Some hand movements, such as lifting heavy objects, may be restricted for 4 to 6 weeks after surgery.
A client is recovering from an abdominal perineal resection. Which of the following measures would most effectively promote wound healing after the perineal drains have been removed? 1. Taking sitz baths. 2. Taking daily showers. 3. Applying warm, moist dressings to the area. 4. Applying a protected heating pad to the area. The correct answer is 1. Taking sitz baths. Sitz baths are an effective way to clean the operative area after an abdominal perineal resection. Sitz baths bring warmth to the area, improve circulation, and promote healing and cleanliness. Most clients find them comfortable and relaxing. Between sitz baths, the area should be kept clean and dry. A shower will not adequately clean the perineal area. Moist dressings may promote wound contamination and delay healing. A heating pad applied to the area for longer than 20 minutes may cause excessive vasodilation, leading to congestion and discomfort. The charge nurse is making the daily assignments on the medical surgical unit. Which patient is best assigned to a float nurse who has come from the post-anesthesia care unit? 1. A 30-year-old patient with thalassemia major who has an order for subcutaneous infusion of deferoxamine. 2. A 43-year-old patient with multiple myeloma who requires discharge teaching. 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. 4. A 65-year-old patient with pernicious anemia who has just been admitted to the unit. The correct answer is 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. A nurse who works in the post-anesthesia care unit will be familiar with the monitoring needed for a patient who has just returned from a procedure such as a colonoscopy, which requires moderate sedation or monitored anesthesia care. Care of the other patients requires staff with more experience with various types of hematologic disorders and would be better to assign to nursing personnel who regularly work on the medical surgical unit. The client diagnosed with chronic sinusitis who has undergone a Caldwell-Luke procedure is complaining of pain. Which intervention should the nurse implement first? 1. Administer the narcotic analgesic IVP. 2. Perform gentle oral hygiene. 3. Place the client in semi-Fowler's position. 4. Assess the client's pain. The correct answer is 4. Assess the client's pain. Prior to intervening, the nurse must assess to determine the amount of pain and possible complications occurring that could be masked if narcotic medication is administered. The client has complained of pain, and the nurse, after determining the severity of the pain and barring any complications in the client, will administer pain medication after completion of the assessment. Oral hygiene helps to prevent the development of infections and promotes comfort, but it will not relieve the pain. Placing the client in the semi-Fowler's position will reduce edema of inflamed sinus tissue, but it will not immediately affect the client's perception of pain. Whenever there is an assessment answer among the answer options, you should look carefully at what is being assessed. If the option says to assess the problem identified in the question, it will usually be the correct answer. Remember, the first step in the nursing process is assessment. The client diagnosed with angina who is prescribed nitroglycerin tells the nurse, "I don't understand why I can't take my sildenafil. I need to take it so that I can make love to my wife." Which statement is the nurse's best response? 1. If you take the medications together, they may cause you to have very low blood pressure. 2. You are worried your wife will be concerned if you cannot make love. 3. If you wait at least 8 hours after taking your nitroglycerin, you can take your sildenafil. 4. You should get clarification with your HCP about taking sildenafil. The correct answer is 1. If you take the medications together, they may cause you to have very low blood pressure. Life-threatening hypotension can result with concurrent use of NTG and sildenafil, a peripheral vasodilator erectile agent.
A client with Raynaud's phenomenon is prescribed diltiazem. An expected outcome is 1. Decreased heart rate. 2. Conversion to normal sinus rhythm. 3. Reduced episodes of finger numbness. 4. Increased SpO2. The correct answer is 3. Calcium channel blockers are first-line drug therapy for the treatment of vasospasms with Raynaud's phenomenon when other therapies are ineffective. Cardizem relaxes smooth muscles and improves peripheral perfusion, therefore reducing finger numbness. Cardizem decreases heart rate and is used to treat atrial fibrillation, but these are not associated with Raynaud's. When vasospasms are prevented, an accurate SpO2 can be measured in the affected extremity. However, SpO2 is a measurement of systemic oxygenation not influenced by cardizem.
A client is scheduled to have an arteriogram. During the arteriogram, the client reports having nausea, tingling, and dyspnea. The nurse's immediate action should be to 1. Administer epinephrine. 2. Inform the physician. 3. Administer oxygen. 4. Inform the client that the procedure is almost over. The correct answer is 2. Inform the physician. Clients may have an immediate or a delayed reaction to the radiopaque dye. The physician should be notified immediately because the symptoms suggest an allergic reaction. Treatment may involve administering oxygen and epinephrine. Explaining that the procedure is over does not address the current symptoms. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client comes to the mental health clinic for a follow-up visit for a diagnosis of major depressive disorder. He says that he has been taking his escitalopram oxalate as prescribed since his second hospitalization 3 months ago. He tells the nurse that he is feeling like my old self again. Now he wants to stop taking medication. I don't want to be dependent on meds like my father. What is the nurse's best initial response to him? 1. After another 3 months of stability, it might be safe for you to go off the escitalopram. 2. After 2 significant episodes, you will need to take an antidepressant indefinitely. 3. Research indicates that individuals who have had 2 major depressive episodes have a 70% chance of having a 3rd episode. 4. It is likely that you can learn to manage your depression with a regular exercise regime and a healthy diet. The correct answer is 3. Research indicates that individuals who have had 2 major depressive episodes have a 70% chance of having a 3rd episode. Rationale. After 2 episodes of a major depressive disorder, the likelihood of a 3rd episode increases to 70%. This information would be useful to convey prior to discussing the importance of continuing his medication. This client also has a family history of depression. A healthy diet and exercise are very significant adjuncts to the therapeutic plan, but may not be sufficient as standalone therapy.
A primary healthcare provider orders out of bed to a chair as the activity level for a patient. How is the nurse functioning when moving this patient out of bed to a chair? 1. Interdependently. 2. Collaboratively. 3. Independently. 4. Dependently. The correct answer is 4. Dependently. Determining the extent of activity desirable for a patient is within the primary healthcare provider's, not a nurse's, scope of practice. Following activity orders is a dependent function of the nurse.
The nurse is working with an assistive personnel to provide care for 6 patients. At the beginning of the shift, the nurse carefully tells the AP what patient interventions and tasks he or she is expected to perform. Which 4 C's guide the nurse's communication with the AP? Select all that apply. 1. Clear. 2. Comprehensive. 3. Concise. 4. Credible. 5. Correct. 6. Complete. The correct answers are 1. Clear, 3. Concise, 5. Correct, and 6. Complete. Rationale. Clear, concise, correct, and complete are the 4 C's of communication. Implementing the 4 C's of communication helps the nurse ensure that the AP understands what is being said, that the AP does not confuse the nurse's directions, that the directions comply with policies, procedures, job descriptions, and the law, and that the AP has all the information necessary to complete the tasks assigned. The triage nurse in the emergency room must prioritize the children waiting to be seen. Which of the following children is in the greatest need of emergency medical treatment? 1. A 6-year-old with fever 104 degrees Fahrenheit, a muffled voice, no spontaneous cough, and drooling. 2. A 3-year-old with fever 100 degrees Fahrenheit, a barky cough, and mild intercostal retractions. 3. A 4-year-old with fever 101 degrees Fahrenheit, a hoarse cough, inspiratory stridor, and restlessness. 4. A 13-year-old with fever 104 degrees Fahrenheit, chills, and a cough with thick yellow secretions. The correct answer is 1. This child is exhibiting signs and symptoms of epiglottitis, which is a medical emergency due to the risk of complete airway obstruction. The 3- and 4-year-olds are exhibiting signs and symptoms of croup. Symptoms often diminish after the child has been taken out in the cool night air. If symptoms do not improve, the child may need a single dose of dexamethasone. Fever should also be treated with antipyretics. The 13-year-old is exhibiting signs and symptoms of bronchitis. Treatment includes rest, antipyretics, and hydration. A nurse administers cefazolin instead of ceftriaxone to an 8-year-old with pneumonia. The client has suffered no adverse effects. The nurse tells the charge nurse of the incident, but fears disciplinary action from reporting the error, the charge nurse should tell the nurse. 1. If you do not report the error, I will have to. 2. Reporting the error helps to identify system problems to improve client safety. 3. Notify the client's primary care provider to see if she wants this reported. 4. This is not a serious mistake, so reporting it will not affect your position. The correct answer is 2. Client safety is enhanced when the emphasis on medication errors is to determine the root cause. All errors should be reported so systems can identify patterns that contribute to errors. Here, the similar names probably contributed to the error. The nurse who commits the error knows all the relevant information and is in the best position to report it. While the primary care provider should be notified, it is a nursing responsibility to report errors, not a primary care provider choice. Relating mistakes to a nurse's position focuses on personal blame. The nurse is preparing a patient for magnetic resonance imaging. Which action can the nurse delegate to the experienced assistive personnel? 1. Teach the patient what to expect during the test. 2. Instruct the patient to remove metal objects, including zippers. 3. Witness that the patient has signed the consent form. 4. Check and record pre-procedure vital signs. The correct answer is 4. Check and record pre-procedure vital signs. Rationale. The AP scope of practice includes checking and recording patient vital signs. Teaching and instructing, as well as witnessing consent forms, is appropriate to the professional nurse's scope of practice. The AP could remind the patient about the removal of metal objects after the patient receives that instruction.
When planning diet teaching for the client with a colostomy, the nurse should develop a plan that emphasizes which of the following dietary instructions. 1. Foods containing roughage should not be eaten. 2. Liquids are best limited to prevent diarrhea. 3. Clients should experiment to find the diet that is best for them. 4. A high-fiber diet will produce a regular passage of stool. The correct answer is 3. Clients should experiment to find the diet that is best for them. It is best to adjust the diet of a client with a colostomy in a manner that suits the client rather than trying special diets. Severe restriction of roughage is not recommended. The client is encouraged to drink 2 to 3 liters of fluid per day. A high-fiber diet may produce loose stools. The nurse is making a room assignment for a newly arrived patient whose laboratory test results indicate pancytopenia. Which patient will be the best roommate for the new patient? 1. Patient with digoxin toxicity. 2. Patient with viral pneumonia. 3. Patient with shingles. 4. Patient with cellulitis. The correct answer is 1. Patient with digoxin toxicity. Patients with pancytopenia are at higher risk for infection. The patient with digoxin toxicity presents the least risk of infecting the new patient. Viral pneumonia, shingles, and cellulitis are infectious processes. The charge nurse on a surgical floor is making assignments. Which client should be assigned to the most experienced nurse? 1. The 36-year-old client who has undergone an antral irrigation for sinusitis yesterday and has moderate pain. 2. The 6-year-old client scheduled for a tonsillectomy and adenoidectomy this morning who will not swallow medication. 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. 4. The 45-year-old client diagnosed with a peritonsillar abscess who requires IVPB antibiotic therapy 4 times a day. The correct answer is 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. The post-operative client with purulent drainage could be developing an infection. The experienced nurse would be needed to assess and monitor the client's condition. Any nurse who is capable of administering IVPB medications can care for this client. This client is 1 day post-operative and has moderate pain, which is to be expected after surgery. A less experienced nurse can care for this client. A child about to go to surgery involving the throat area can be expected to have painful swallowing. This does not require the most experienced nurse. In this type of question, you must determine if the situation described is expected or within normal limits. The option that gives unexpected data or data not within normal limits, requires a nurse with more knowledge and experience. The client diagnosed with a myocardial infarction is receiving thrombolytic therapy. Which data warrants immediate intervention by the nurse? 1. The client's telemetry has reperfusion dysrhythmias. 2. The client is oozing blood from the IV site. 3. The client is alert and oriented to date, time, and place. 4. The client has no signs of infiltration at the insertion site. The correct answer is 2. The client is oozing blood from the IV site. Any bleeding from the IV site, gums, rectum, or vagina should be reported to the HCP. The HCP may not be able to take intervention to prevent the bleeding during therapy, but it warrants notifying the HCP.
When giving discharge instructions to the client with vasospastic disorder, Raynaud's phenomenon, the nurse should explain that the expected outcome of taking a beta-adrenergic blocking medication is to control the symptoms by 1. Decreasing the influence of the sympathetic nervous system on the tissues in the hands and feet. 2. Decreasing the pain by producing analgesia. 3. Increasing the blood supply to the affected area. 4. Increasing monoamine oxidase. The correct answer is 1. Beta-adrenergic medications block the beta-adrenergic receptors. Therefore, the expected outcome of the medication is to decrease the influence of the sympathetic nervous system on the blood vessels in the hands. Beta-adrenergic blockers have no analgesic effects. Increasing blood supply to the affected area is an indirect effect of beta-adrenergic blockers. They do not increase monoamine oxidase, which does not play a role in Raynaud's disease.
A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2. Wire cutters and 4. Suction equipment. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code cart is not needed at the bedside.
The intake nurse is making an assessment of a client who has just arrived at the emergency department. Which of the following comments from this client who is taking phenelzine, a monoamine oxidase inhibitor, for treatment-resistant depression should be given top priority? 1. My bowels haven't moved in the last 2 days. 2. What was my temperature? I'm feeling warm. 3. My legs feel stiff after I sit in the chair for a while. 4. I have a throbbing headache. The correct answer is 4. I have a throbbing headache. Rationale. A serious, life-threatening reaction to MAO inhibitors is hypertensive crisis. Although this medication is inclined to reduce blood pressure, in combination with too much tyramine, blood pressure can rise to a dangerous level. A throbbing headache could be a significant indicator of an impending crisis.
A nurse witnesses an accident and assists the victim who has a life-threatening injury. Which should the nurse do to meet an important standard of care when acting as a good Samaritan at the scene of an accident? 1. Seek consent from the injured party before rendering assistance. 2. Implement every critical care intervention necessary to sustain life. 3. Stay on the scene until another qualified person takes over responsibility. 4. Insist on helping because a nurse is the best qualified person to provide care. The correct answer is 3. Stay on the scene until another qualified person takes over responsibility. When a nurse renders emergency care, the nurse has an ethical responsibility not to abandon the injured person. The nurse should not leave the scene until the injured person leaves or another qualified person assumes responsibility. Depending on the injured person's physical and emotional status, the person may or may not be able to consent to care. The nurse should not attempt interventions that are beyond the scope of nursing practice.
The nurse is caring for a patient with carpal tunnel syndrome who has been admitted for surgery. Which intervention should be delegated to the assistive personnel? 1. Initiating placement of a splint for immobilization during the day. 2. Assessing the patient's wrist and hand for discoloration and brittle nails. 3. Assisting the patient with daily self-care measures such as bathing and eating. 4. Testing the patient for painful tingling in the 5 digits of the hand. The correct answer is 3. Assisting the patient with daily self-care measures such as bathing and eating. Rationale. Helping with activities of daily living is within the scope of practice of APs. Placing a splint for the first time is appropriate to the scope of practice of physical therapists. Assessing and testing for paresthesia are not within the scope of practice of APs and are appropriate for professional nurses.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client with Berger's disease has established a goal to stop smoking. Which medication would be the most helpful in attaining this goal? 1. Bupropion. 2. Nicotine. 3. Nitroglycerin. 4. Ibuprofen. The correct answer is 1. Bupropion is used to promote smoking cessation. All types of nicotine should be avoided to prevent vasoconstriction. Nitroglycerin, used for angina, and ibuprofen, an anti-inflammatory medication, have no role in smoking cessation. The primary goal for the client with Berger's disease is to prevent 1. Embolus formation. 2. Fat embolus formation. 3. Thrombus formation. 4. Thrombophlebitis. The correct answer is 3. Because of the inflammation. A common complication of Berger's disease is thrombus formation and potential occlusion of the vessel. Inflammation of the immediate and small arteries and veins is involved in the disease process. Embolus is a potential risk if a thrombus has developed. Fat embolus is associated with fractures of the bones. Thrombophlebitis occurs after thrombus formation.
The client diagnosed with arterial hypertension develops a cold. Which information regarding over-the-counter medications should the nurse teach? 1. Try to find a medication that will not cause drowsiness. 2. OTC medications are not as effective as a prescription. 3. OTC medications are more expensive than prescriptions. 4. Do not take OTC medication unless approved by the HCP. The correct answer is 4. Do not take OTC medication unless approved by the HCP. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. The client should only take medications approved by the HCP that will not affect the client's hypertension. The client should be informed about the dangers of self-medicating with OTC medications. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. Efficacy of medications depends on the medication and strength.
Which safety measures will be most important to implement when caring for a client who is receiving 2 units of packed red blood cells? Select all that apply. 1. Verify that the ABO and RH of the 2 units are the same. 2. Infuse a unit of PRBCs in less than 4 hours. 3. Stop the transfusion if a reaction occurs, but keep the line open. 4. Take vital signs every 15 minutes while the unit is transfusing. 5. Inspect the blood bag for leaks, abnormal color, and clots. 6. Use a 22-gauge catheter for optimal flow of a blood transfusion. The correct answers are 2, 3, and 5. The American Association of Blood Banks and Canadian Blood Services recommend that 2 qualified people, such as 2 licensed nurses, compare the name and number on the identification bracelet with the tag on the blood bag. Verifying that the 2 units are the same is not a recommendation. Rather, the verification is always with the client, not with bags of blood. A unit of blood should infuse in 4 hours or less to avoid the risk of septicemia, since no preservatives are used. When a blood transfusion reaction occurs, the blood transfusion should be stopped immediately, but the 4 lines should be kept open so that emergency medications and fluids can be administered. The unit of PRBC should be inspected for contamination by looking for leaks, abnormal color, clots, and excessive air bubbles. When a unit of PRBCs is being transfused, vital signs are assessed before the transfusion begins, after the first 15 minutes, and then every hour until 1 hour after the transfusion has been completed. When PRBCs are being administered, a 20-gauge or larger needle is needed to avoid destroying the red blood cells passing through the lumen and to allow for maximal flow rate.
A nurse teaches a client experiencing heartburn to take 1.5 ounces of Mulox when symptoms appear. How many milliliters should the client take? Blank milliliters. The correct answer is 45 milliliters. 1 ounce equals to 30 milliliters. To solve this problem, you set up the formula as 1 ounce over 30 milliliters equals to 1.5 ounces over x. You cross-multiply 1 times x and 30 times 1.5. You get 1x equals to 45. You divide by 1 on both sides, and you get x equals to 45 milliliters.
If the client displays risk factors for coronary artery disease, such as smoking cigarettes, eating a diet high in saturated fat, or leading a sedentary lifestyle, techniques of behavior modification may be used to help the client change the behavior. The nurse can best reinforce new adaptive behaviors by 1. Explaining how the risk factor behavior leads to poor health. 2. Withholding praise until the new behavior is well established. 3. Rewarding the client whenever the acceptable behavior is performed. 4. Instilling mild fear into the client to extinguish the behavior. The correct answer is 3. Rewarding the client whenever the acceptable behavior is performed. Rationale. A basic principle of behavior modification is that behavior that is learned and continued is behavior that has been rewarded. Other reinforcement techniques have not been found to be as effective as reward.
The nurse is preparing to administer medications in the antepartum unit. Which medication should the nurse question administering? 1. Terbutaline to a client preparing for an external cephalic version. 2. Hydralazine to a client diagnosed with preeclampsia. 3. Methotrexate to a client with an ectopic pregnancy. 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. The correct answer is 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. Prochlorperazine is contraindicated in pregnancy. Ondansetron and promethazine are more common medications for nausea and vomiting in pregnancy. Terbutaline can be administered to the client preparing for an external version to relax the uterine muscle for manipulation of the fetus. Hydralazine is commonly used for elevated blood pressure in pregnancy. Methotrexate, a folic acid antagonist, is used for medical management of an early ectopic pregnancy with an intact fallopian tube.
A patient with a fractured fibula is receiving skeletal traction and has skeletal pins in place. What would the nurse instruct the assistive personnel to report immediately? 1. The patient wants to change position in bed. 2. There is a small amount of clear fluid at the pin sites. 3. The traction weights are resting on the floor. 4. The patient reports pain and muscle spasm. The correct answer is 3. The traction weights are resting on the floor. Rationale. When the weights are resting on the floor, they are not exerting pulling force to provide reduction and alignment or to prevent muscle spasm. The weights should always hang freely. Attending the weights may reduce the patient's pain and spasms. With skeletal pins, a small amount of clear fluid drainage is expected. It is important to inspect the traction system after a patient changes position because position changes may alter the traction.
A client refuses to look at or care for her colostomy. Which of the following statements by the nurse would be most appropriate? 1. It has been 4 days since your surgery, and you will soon be discharged. You have to learn to care for your colostomy before you leave the hospital. 2. I think we will need to teach your husband to care for your colostomy if you are not going to be able to do it. 3. I understand how you are feeling. It is important for you to feel attractive, and you think having a colostomy changes your attractiveness. 4. I can see that you are upset. Would you like to share your concerns with me? The correct answer is 4. I can see that you are upset. Would you like to share your concerns with me? It is important for the nurse to recognize that individuals go through a grieving process when adjusting to a colostomy. The nurse should be accepting and provide the client with opportunities to share her concerns and feelings when she is ready. Lecturing the client about the need to learn how to care for the colostomy is not productive, nor is attempting to shame her into caring for the colostomy by implying her husband will have to provide the care if she does not. It is not possible for the nurse to understand what the client is feeling. A patient who has sickle cell disease is admitted with vaso-occlusive crisis and reports severe abdominal and flank pain. Which of the analgesic medications on the pain treatment protocol will be best for the nurse to administer initially? 1. Ibuprofen 800 mg PO. 2. Morphine sulfate 4 mg IV. 3. Hydromorphone liquid 5 mg PO. 4. Fentanyl 25 micrograms per hour transdermal patch. The correct answer is 2. Morphine sulfate 4 mg IV. Guidelines for the management of vaso-occlusive crisis suggest the rapid use of parenteral opioids for patients who have moderate to severe pain. The other medications may also be appropriate for the patient as the crisis resolves, but are not the best choice for rapid treatment of severe pain. The nurse is changing a hydrocolloid antimicrobial barrier, dressing with silver, for a client diagnosed with a stage 4 pressure ulcer. Which intervention should the nurse implement first? 1. Rinse the wound with physiologically normal saline. 2. Remove the old dressing and assess the pressure ulcer. 3. Hold the dressing in place for 5 seconds after applying. 4. Apply sterile gloves when performing the procedure. The correct answer is 2. Remove the old dressing and assess the pressure ulcer. Removing the old dressing and assessing the pressure ulcer for healing is the first intervention. The nurse should rinse the wound with physiologically normal saline, but this is not the first intervention. This dressing must be held in place for 5 seconds after applying it to the pressure ulcer. The dressing change is performed with non-sterile gloves using aseptic technique. Therefore, this is not an appropriate intervention. A child's parent asks the nurse what treatment the child will need for the diagnosis of strep throat. Which is the nurse's best response? 1. Your child will be sent home on bed rest and should recover in a few days without any intervention. 2. Your child will need to have the tonsils removed to prevent future strep infections. 3. Your child will need oral penicillin for 10 days and should feel better in a few days. 4. Your child will need to be admitted to the hospital for 5 days of intravenous antibiotics. The correct answer is 3. Your child will need oral penicillin for 10 days and should feel better in a few days. The child will need a 10-day course of penicillin amoxicillin to treat the strep infection. It is essential that the nurse always tell the family that, although the child will feel better in a few days, the entire course of antibiotics must be completed. Answer 2 can be eliminated because it is a treatment for recurrent tonsillitis, not strep throat. Answer 1 can be eliminated if the test taker understands that bacterial infections need to be treated with antibiotics.
The nurse is assessing a client with Buerger's disease. The nurse should determine if the client is experiencing 1. Thickening of the intima and media of the artery. 2. Inflammation and fibrosis of arteries, veins, and nerves. 3. Vasospasm lasting several minutes. 4. Pain, pallor, and pulselessness. The correct answer is 2. Buerger's disease is characterized by inflammation and fibrosis of arteries, veins, and nerves. White blood cells infiltrate the area and become fibrotic, which results in occlusion of the vessels. Signs and symptoms include slowly developing claudication, cyanosis, coldness, and pain at rest. Thickening of the intima and media of the artery is characteristic of atherosclerosis. Vasospasm lasting several minutes is characteristic of Raynaud's disease. Pain, pallor, and pulselessness are symptoms of acute occlusion of an artery by an embolus or other cause such as compartment syndrome. A client with Buerger's disease smokes 2 packs of cigarettes a day. When helping a client change smoking behavior, It is important to know the clients. 1. Ability to attend support groups. 2. Goals for the treatment. 3. Perception of the negative behavior. 4. Motivation. The correct answer is 3. When helping a client change detrimental health behavior, it is critical to learn how the client perceives a situation or problem. The client is more likely to change detrimental health behaviors if he realizes that there's a problem and that these behaviors lead to the problem. While understanding the client's ability to attend group meetings, his goals for treatment, and his motivation may help facilitate change, the nurse should first understand the client's perception of the problem and then determine what strategies might work from his perspective. Which of the following clients is at greatest risk for Buerger's disease? 1. A 29-year-old male with a 14-year history of cigarette smoking. 2. A 38-year-old female who is taking birth control pills. 3. A 54-year-old female with adult-onset diabetes. 4. A 65-year-old male with atherosclerosis. The correct answer is 1. Buerger's disease is a non-atherosclerotic, inflammatory vaso-occlusive disorder. The disorder occurs predominantly in younger men, less than 40 years of age, and there is a very strong relationship with tobacco use. Diagnosis is based on age of onset, history of tobacco use, symptoms, and exclusion of diabetes mellitus.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which assessment data warrants immediate intervention for the client in labor who is receiving an oxytocin infusion via pump? 1. The uterus periodically becomes hard and firm. 2. The client reports an urgency to void. 3. The client denies the urge to push. 4. The fetal heart rate does not return to baseline. The correct answer is 4. The fetal heart rate does not return to baseline. During a contraction, the fetal heart rate will decrease, but should return to the baseline fetal heart rate after the contraction. If this does not occur, it indicates the infant is in distress, and this warrants immediate intervention. This could also be a sign of uterine rupture resulting from overstimulation of the uterus. The oxytocin infusion should be stopped immediately. The uterus becoming hard and firm periodically indicates a contraction, which is expected when administering a uterine stimulant. The client wanting to urinate would be expected because the baby's head is pushing against the bladder. Denying the urge to push indicates the client is not in the last stages of labor.
The emergency department nurse should question which healthcare provider prescription when providing care for an older adult with a fracture of the left ulna. 1. Get x-rays of the left forearm. 2. Give him a Paradine IM for pain. 3. Monitor vital signs every hour. 4. Elevate left arm on pillows. The correct answer is 2. Give him a Paradine IM for pain. Meperidine should not be used because of its toxic metabolites that can cause seizures and other adverse drug events, especially in the older adult population. X-rays are used to confirm the diagnosis. Vital signs and elevation are common actions for a patient in the emergency department, and elevation can decrease the swelling in the affected extremity.
Which of the following skin preparations would be best to apply around the client's colostomy? 1. Stomadhesive. 2. Petroleum jelly. 3. Cornstarch. 4. Antiseptic cream. The correct answer is 1. Stomadhesive. Stomadhesive is effective for protecting the skin around a colostomy to keep the skin healthy and prevent skin irritation from stoma drainage. Petroleum jelly, cornstarch, and antiseptic creams do not protect the skin adequately and may prevent an adequate seal between the skin and the colostomy bag. These activities are included in the care plan for a 78-year-old patient admitted to the hospital with anemia caused by possible gastrointestinal bleeding. Which activity can the nurse delegate to an experienced assistive personnel? 1. Obtaining stool specimens for the fecal occult blood test. 2. Having the patient sign a colonoscopy consent form. 3. Giving the prescribed polyethylene glycol electrolyte solution. 4. Checking for allergies to contrast dye or shellfish. The correct answer is 1. Obtaining stool specimens for the fecal occult blood test. An experienced AP will have been taught how to obtain a stool specimen for the fecal occult blood test because this is a common screening test for hospitalized patients. Having the patient sign an informed consent form should be done by the healthcare provider who will be performing the colonoscopy. Administering medications and checking for allergies are within the scope of practice of licensed nursing staff. The influenza vaccine is in short supply. Which group of clients would the public health nurse consider priority when administering the vaccine? 1. Elderly and chronically ill clients. 2. Childcare workers and children less than 4 years of age. 3. Hospital chaplains and healthcare workers. 4. School teachers and students living in a dormitory. The correct answer is 1. Elderly and chronically ill clients. The elderly and chronically ill are at greatest risk for developing serious complications if they contract the influenza virus. It is recommended people in contact with children receive the flu vaccine whenever possible, but these clients should be able to withstand a bout with the flu if their immune systems are functioning normally. It is probable these clients will be exposed to the virus, but they are not as likely to develop severe complications with intact functioning immune systems. During flu season, the more people the individual comes into contact with, the greater the risk the client will be exposed to the influenza virus, but this group of people would not receive the vaccine before the elderly and chronically ill. Sometimes, you may think the answer is too easy and obvious, but you should not try to second-guess the question. Test writers are not trying to trick you, they are trying to evaluate knowledge. The nurse is administering 9 o'clock medications to the following clients. Which client should the nurse question administering the medication? 1. The client receiving a calcium channel blocker who drank a glass of grapefruit juice. 2. The client receiving a beta blocker who has an apical pulse of 62 beats per minute. 3. The client receiving a nitroglycerin patch who has a blood pressure of 148/92. 4. The client receiving an antiplatelet medication who has a platelet count of 150,000. The correct answer is 1. The client receiving a calcium channel blocker who drank a glass of grapefruit juice. The client receiving a calcium channel blocker should avoid grapefruit juice because it can cause the calcium channel blocker to rise to toxic levels. Grapefruit juice can inhibit the metabolism of certain medications. Specifically, grapefruit juice inhibits cytochrome P450, 3A, 4 found in the liver and the intestinal wall. The nurse should investigate any medications the client is taking if the client drinks grapefruit juice.
In order to prevent recurrent vasospastic episodes with Raynaud's phenomenon, the nurse should instruct the client to 1. Keep the hands and feet elevated as much as possible. 2. Use a vibrating massage device on the hands. 3. Wear gloves when obtaining food from the refrigerator. 4. Increase coffee intake to 2 cups per day. The correct answer is 3. Loose, warm clothing should be worn to protect from the cold. Wearing gloves when handling cold objects will help prevent vasospasms. Vibrating equipment and typing contribute to vasospasm. Tobacco and caffeine should be avoided. Elevation will decrease arterial perfusion during vasospasms.
A client is scheduled for an arteriogram. The nurse should explain to the client that the arteriogram will confirm the diagnosis of occlusive arterial disease by 1. Showing the location of the obstruction and the collateral circulation. 2. Scanning the affected extremity and identifying the areas of volume changes. 3. Using ultrasound to estimate the velocity changes in the blood vessels. 4. Determining how long the client can walk. The correct answer is 1. Showing the location of the obstruction and the collateral circulation. An arteriogram involves injecting a radiopaque contrast agent directly into the vascular system to visualize the vessels. It usually involves computed tomographic scanning. The velocity of the blood flow can be estimated by duplex ultrasound. The client's ankle brachial index is determined, and then the client is requested to walk. The normal response is little or no drop in ankle systolic pressure after exercise.
A nurse is educating a client who has been diagnosed with dysthymia about possible treatment for the disorder. Which response by the nurse is most appropriate? 1. Antidepressants, particularly the selective serotonin reuptake inhibitor, SSRI, group, offer you the best treatment for your dysthymia. 2. Doctors recommend that clients experiencing dysthymia receive electroconvulsive therapy, ECT, to treat their disorder. 3. Because you have a mild, though long-lasting dysthymic mood, psychotherapy can usually bring improvement with less likelihood of the need for medication. 4. Since your dysthymia indicates a long-lasting mild depression, long-term psychoanalysis would be the best treatment for you. The correct answer is 3. Because you have a mild, though long-lasting dysthymic mood, psychotherapy can usually bring improvement with less likelihood of the need for medication. Rationale. Dysthymia is a milder, persistent type of depression in which sufferers are able to minimally carry on their work. Antidepressant and ECT are treatments used for occurrences of major depression, with ECT being used as a last resort when several medications fail. Psychoanalysis is a very involved, long-term treatment rarely used now due to its cost and the long period of treatment required for results.
Which element of ethical practice is associated with fair policies and procedures guiding allocation of organs for transplantation? 1. Justice. 2. Fidelity. 3. Veracity. 4. Non-maleficence. The correct answer is 1. Justice. Justice refers to fairness and that all patients should be treated equally, impartially, and without prejudice regardless of individual factors. Fidelity refers to making only promises or commitments that can be kept. Veracity refers to being truthful, which is essential to a trusting nurse-patient relationship. Non-maleficence refers to preventing harm, avoiding actions that can cause harm, or removing a patient from harm.
The nurse delegates the measurement of vital signs to an experienced assistive personnel. Osteomyelitis has been diagnosed in a patient. Which vital sign value would the nurse instruct the AP to report immediately for this patient? 1. Temperature of 101 degrees Fahrenheit. 2. Blood pressure of 136/80. 3. Heart rate of 96 beats per minute. 4. Respiratory rate of 24 breaths per minute. The correct answer is 1. Temperature of 101 degrees Fahrenheit. Rationale. An elevated temperature indicates infection and inflammation. This patient needs IV antibiotic therapy. The other vital sign values are normal or high normal. The charge nurse observes an LPN/LVN assigned to provide all of these interventions for a patient with Paget disease. Which action requires that the charge nurse intervene? 1. Administering 600 milligrams of ibuprofen to the patient. 2. Encouraging the patient to perform exercises recommended by a physical therapist. 3. Applying ice and gentle massage to the patient's lower extremities. 4. Reminding the patient to drink milk and eat cottage cheese. The correct answer is 3. Applying ice and gentle massage to the patient's lower extremities. Rationale. Applying heat, not ice, is the appropriate measure to help reduce the patient's pain. Ibuprofen is useful to manage mild to moderate pain. Exercise prescribed by a physical therapist would be non-impact in nature and provide strengthening for the patient. A diet rich in calcium promotes bone health.
The nurse is discussing the neonatal blood screening test with a new mother. The nurse knows that the teaching was successful when the mother states that the test screens for the presence in the newborn of which of the following diseases? Select all that apply. 1. Hypothyroidism. 2. Sickle cell disease. 3. Galactosemia. 4. Cerebral palsy. 5. Cystic fibrosis. The correct answers are 1. Hypothyroidism, 2. Sickle cell disease, 3. Galactosemia, and 5. Cystic fibrosis. Congenital hypothyroidism is a malfunction of or complete absence of the thyroid gland that is present from birth. It is screened for in all 50 states. Sickle cell disease is an autosomal recessive disease resulting in abnormally shaped red blood cells. It is screened for in all 50 states. Galactosemia is an incurable autosomal recessive disease characterized by the absence of the enzyme required to metabolize galactose. It is screened for in all 50 states. Cystic fibrosis is an autosomal recessive illness characterized by the presence of thick mucus in many organ systems, most notably the respiratory tract. It is screened for in all 50 states. Cerebral palsy is a disorder characterized by motor dysfunction resulting from a non-progressive injury to brain tissue. The injury may occur during pregnancy, labor, delivery, or shortly after delivery. Physical examination is required to diagnose cerebral palsy. Blood screening is not an appropriate means of diagnosis. It is important to realize that neonatal screening is state-specific. Each state determines which diseases will be screened for. In March 1915, the Advisory Committee on Heritable Disorders in Newborns and Children recommended that all newborns be screened for 32 core disorders and 26 secondary disorders. Unfortunately, many states screen for far fewer disorders. The elderly client diagnosed with coronary artery disease has been taking aspirin daily for more than a year. Which data warrants notifying the HCP? 1. The client has lost 5 pounds in the last month. 2. The client has trouble hearing low tones. 3. The client reports having a funny taste in the mouth. 4. The client has hard, dark, tarry stools. The correct answer is 4. The client has hard, dark, tarry stools. A complication of long-term aspirin use is gastric bleeding, which could result in dark, tarry stools. This data would warrant further intervention.
The nurse is teaching a client and his family about the client's new diagnosis of hemochromatosis. Which of the following details should the nurse include? 1. Hemochromatosis is an autoimmune disorder that affects the HFE gene. 2. Individuals who are heterozygous for hemochromatosis rarely develop the disease. 3. Individuals who are homozygous for hemochromatosis are carriers of hemochromatosis. 4. Men are at greater risk for hemochromatosis. The correct answer is 2. The nurse should teach the client and family that individuals who are heterozygous for hemochromatosis rarely develop the disease. Men and women are equally at risk for hemochromatosis, but men are diagnosed earlier because women do not usually have manifestations until menopause. Hemochromatosis is the most common genetic disorder in Canada and the United States. Individuals who are homozygous for hemochromatosis receive a defective gene from each parent. Those with homozygous genes may develop the disease.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client has returned from surgery during which the jaws were wired as treatment for a fractured mandible. The client is in a stable condition. The nurse is instructing the unlicensed nursing personnel on how to properly position the client. Which instructions about positioning would be appropriate for the nurse to give the UAP? 1. Keep the client in a side-lying position with the head slightly elevated. 2. Do not reposition the client without the assistance of a nurse. 3. The client can assume any position that is comfortable. 4. Keep the client's head elevated on 2 pillows at all times. The correct answer is 1. Keep the client in a side-lying position with the head slightly elevated. Immediately after surgery, the client should be placed on the side with the head slightly elevated. This position helps facilitate removal of secretions and decreases the likelihood of aspiration should vomiting occur. A nurse does not need to be present to reposition the client unless the client's condition warrants the presence of the nurse. Although it is important to elevate the head, there is no need to keep the client's head elevated on 2 pillows unless that position is comfortable for the client.
A middle-aged adult with a family history of CAD has the following: total cholesterol 198, LDL cholesterol 120, HDL cholesterol 58, triglycerides 148, blood sugar 102, and C-reactive protein 4.2. The healthcare provider prescribes a statin medication and aspirin. The client asks the nurse why these medications are needed. Which is the best response by the nurse? 1. The labs indicate severe hyperlipidemia and the medications will lower your LDL, along with a low-fat diet. 2. The triglycerides are elevated and will not return to normal without these medications. 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. 4. These medications will reduce the risk of type 2 diabetes. The correct answer is 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. Rationale. CRP is a marker of inflammation and is elevated in the presence of cardiovascular disease. The high-sensitivity CRP is the blood test for greater accuracy in measuring the CRP to evaluate cardiovascular risk. The family history, postmenopausal age, LDL above optimum levels, and elevated CRP place the client at risk of CAD. Statin medications can decrease LDL, whereas statins and aspirin can reduce CRP and decrease the risk of MI and stroke. The blood sugar is within normal limits.
The nurse is teaching the pregnant client diagnosed with HIV about methods to prevent transmission to the infant. Which information should the nurse discuss with the client? Select all that apply. 1. The client will take zidovudine PO regularly beginning at 12 to 14 weeks gestation. 2. The client's newborn should receive oral zidovudine 8 to 12 hours after birth. 3. Breastfeeding should be encouraged to provide the infant passive immunity to HIV. 4. If treated in early pregnancy, the risk of transmission of HIV to the infant is 1% or less. 5. All clients diagnosed with HIV must have a cesarean delivery at 38 weeks gestation. The correct answers are 1. The client will take zidovudine PO regularly beginning at 12 to 14 weeks gestation. 2. The client's newborn should receive oral zidovudine 8 to 12 hours after birth. And 4. If treated in early pregnancy, the risk of transmission of HIV to the infant is 1% or less. Zidovudine is given orally, as directed, around the clock. The newborn should receive oral zidovudine syrup beginning 8 to 12 hours after birth until 6 weeks old. The Centers for Disease Control states that if the client is treated beginning in early pregnancy, the risk of transmission of HIV to the infant can be reduced to 1% or less. Breastfeeding is not recommended because HIV is present in breast milk. The choice of delivery method, vaginal or cesarean, is dependent on the concentration of the virus in maternal plasma. Cesarean delivery before the onset of labor and rupture of membranes can reduce the transmission of the HIV virus. However, the method of delivery needs to be individualized to each client.
A patient has a fractured femur, which finding would the nurse instruct the assistive personnel to report immediately. 1. The patient reports pain. 2. The patient appears confused. 3. The patient's blood pressure is 136/88. 4. The patient voided using the bedpan. The correct answer is 2. The patient appears confused. Rationale. Fat embolism syndrome is a serious complication that often results from fractures of long bones. Its earliest manifestation is altered mental status caused by a low arterial oxygen level. The nurse would want to know about and treat the pain, but it is not life-threatening. The nurse would also want to know about the blood pressure in the patient's voiding. However, this information is not urgent to report.
Which should the nurse include when teaching a 55-year-old woman in the beginning of menopause? Select all that apply. 1. The average age of onset for menopause is 50 to 52 years. 2. Follicle-stimulating hormone and luteinizing hormone levels elevate. 3. Depression is very common as a result of menopause. 4. Hot flashes, especially at night, can occur in about 80% of women. 5. When periods become irregular, contraception is unnecessary. The correct answers are 1. The average age of onset for menopause is 50 to 52 years. 2. Follicle-stimulating hormone and luteinizing hormone levels elevate. And 4. Hot flashes, especially at night, can occur in about 80% of women. The average age of menopause is 50 to 52 years, although some variation exists. With menopause, follicle-stimulating hormone and luteinizing hormone levels increase dramatically. Hot flashes occur in about 80% of women. They can range from mild to very debilitating with disruption of sleep patterns. Depression is not usual during menopause. If symptoms of depression do occur, the nurse should refer the woman to her healthcare provider. Contraception should be used until menses has ceased for a full year. A client sustains a chemical eye injury from a splash of battery acid. The nurse should prepare the client for which immediate measure? 1. Checking visual acuity. 2. Covering the eye with a pressure patch. 3. Swabbing the eye with antibiotic ointment. 4. Irrigating the eye with sterile normal saline. The correct answer is 4. Irrigating the eye with sterile normal saline. Emergency care after a chemical burn to the eye includes irrigating the eye immediately with sterile normal saline or ocular irrigating solution. The irrigation should be maintained for at least 10 minutes. After this emergency treatment, visual acuity is assessed. Options 2 and 3 are not immediate measures. The nurse is using the antimicrobial binding dressing Actisorb Silver 220 for a stage 3 pressure ulcer on the left hip area. The dressing is a combination of silver and activated charcoal. Which intervention should the nurse implement? 1. Perform the sterile dressing change twice a day. 2. Avoid cutting the dressing when applying it to the wound. 3. Pre-medicate the client with a narcotic analgesic. 4. Do not use tape to hold the secondary dressing in place. The correct answer is 2. Avoid cutting the dressing when applying it to the wound. The nurse should avoid cutting the dressing because particles of activated charcoal may get into the wound and cause discoloration. The dressing may be left in place for up to 7 days or may be changed every 24 hours, but it would not be changed twice a day. This does not allow the dressing adequate time to increase healing of the wound. The dressing change does not warrant administering a narcotic analgesic to the client. Tape should be used to hold the secondary dressing in place, or the antimicrobial binding dressing will not remain in the pressure ulcer. A 7-month-old has a low-grade fever, nasal congestion, and a mild cough. What should the nursing care management of this child include? Select all that apply. 1. Maintaining strict bed rest. 2. Avoiding contact with family members. 3. Instilling saline nose drops and bulb suctioning. 4. Keeping the head of the bed flat. 5. Providing humidity and propping the head of the bed up. The correct answers are 3. Instilling saline nose drops and bulb suctioning, and 5. Providing humidity and propping the head of the bed up. Infants are nose breathers and often have increased difficulty when they are congested. Nasal saline drops and gentle suctioning with a bulb syringe are often recommended. Other helpful suggestions for infants with colds are to provide humidity with a cool mist humidifier or take them into a steamy bathroom. In addition, raising the head of the bed helps with drainage of secretions. You can eliminate answer 4 given a basic understanding of interventions to improve respiratory function.
The charge nurse is making assignments for the day shift. Which patient should be assigned to the nurse who was floated from the post-anesthesia care unit for the day? 1. A 35-year-old patient with osteomyelitis who needs teaching before hyperbaric oxygen therapy. 2. A 62-year-old patient with osteomalacia who is being discharged to a long-term care facility. 3. A 68-year-old patient with osteoporosis given a new orthotic device whose knowledge of its use must be assessed. 4. A 72-year-old patient with Paget disease who has just returned from surgery for total knee replacement. The correct answer is 4. A 72-year-old patient with Paget disease who has just returned from surgery for total knee replacement. Rationale. The post-anesthesia care unit nurse is very familiar with the assessment skills necessary to monitor a patient who just underwent surgery. For the other patients, nurse is familiar with musculoskeletal system. Related nursing care are needed to provide teaching and assessment and prepare a report to the long-term care facility. The nurse's assessment reveals all of these data when a patient with Paget disease is admitted to the acute care unit. Which findings should the nurse notify the healthcare provider about first? 1. There is a bowing of both legs, and the knees are asymmetrical. 2. The base of the skull is invaginated platybasia. 3. The patient is only 5 feet tall and weighs 120 pounds. 4. The skull is soft, thick, and larger than normal. The correct answer is 2. The base of the skull is invaginated platybasia. Rationale: platybasia, basilar skull invagination, causes brainstem manifestations that threaten life. Patients with Paget disease are usually short and often have bowing of the long bones that results in asymmetrical knees or elbow deformities. The skull is typically soft, thick, and enlarged.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanursiguide.com.